2020 meeting to order. Could I have a motion to approve the agenda? We're going to go with Mr. Swartz made the motion. Mr. Denisha seconded it. All in favor?
Aye.
Opposed? Carried. Motion to approve the June Services Committee minutes. Is there a motion, Mr. Denisha? Seconded by Ms. Kern. Any discussion? No discussion. All in favor?
Aye.
Opposed? Carried. Now, next on the agenda will be the COVID update by Dr. Williams. We'll go first, and then that'll be followed by Dr. Dana McGuire.
Actually, with your permission, if Dr. McGuire could go first.
Dr. McGuire, what was his question?
Go first.
Well, yes, go ahead. Dr. McGuire, go ahead. Go first. Couldn't hear you very well.
Thank you very much. So I just want to give an update where we are with the cases and some of the things that we have going on. So since we started, we have 229 cases in the county. Since the beginning of this month, we have 12 new cases. Currently, we have 8 of those that are actively in isolation still. And of those 12 cases, 5 are due to travel. And so this is due to the new travel advisory, people coming back, they've been tested and they're positive. One thing to note of these 5 travelers is 3 of those have had just significant symptoms. And so we've been talking for a while now that when the response started, we had many people who had symptoms, and we've now been seeing a lot of cases who are asymptomatic. But with these travel cases from those states, there have been people who have been quite ill. So that's just something just to keep in mind. Since the travel advisory started, we have put just about like 50 people into quarantine. And we know of these people through 3 reasons. One is that when people fly through airports, and now just today due to trains and to buses and to cars, some of those people should fill out a form. And so that information then comes straight to the public health department, gets put into our system, and we call those people. They can also call the local health department. Jack, please help me. I'm sorry. They can call the local health department. And so we have just many of the travelers know that when they come back, they should alert us and we can put them into the quarantine process. And then we also have it through the complaint line, through the hotline of the New York State. And so we get emails of those people, we get their contact information, and then that's how we can put them into quarantine. So you can see that when people call us on their own, those conversations go well, but it is kind of, it's been upsetting to those people who we call due to the file of the complaint, and when airports get that information. And so staff, when they make those contacts, it can be very difficult. We have had just 21,000 people, or just over that, be tested. And the 21 to 30 age group is still the largest group we have here just in the county. For the mask wearing campaign that we had 40 submissions. And so we are just starting to take a look at those. We have a work group on that, and we'll be trying to select some of those like submissions so we can get those just around the county and possibly do a billboard. So our department continues to work hard. We have increased the amount of people who are in the quarantine process by about 200% just this month. We were down to about 30 people in quarantine, and we're currently up to about 150. And so we continue to work all days of the week. And the staff is really working hard to get the information out, to make the phone calls, and to help be sure that we're clear on the information. So if there's any questions about the status and what the department is working on, or what we're seeing with the travel advisory.
Are there any questions? Margaret? Okay, let me get my glasses so I can see that screen a little better, Margaret. Go
Thank
ahead,
you.
Ms. Haggard.
Dana, I didn't quite hear what you said about the 21 to 30 age group. Did you say that was the predominance of positives?
That is the largest age group that we have that has been positive since we've started the response. Yes.
Thank you.
Mhm.
Any other questions? Just speak up in here. Okay, go ahead.
Dana, how many of that group have been hospitalized?
In the 21 to 30,
Yes, ma'am.
I am not sure of all the ages on the hospitalizations. I'll have to get that to you.
Any further questions? Dana? Mr. Burke, go ahead. Go ahead, Mr. Burke. Mr. Burke? Go ahead,
Gotcha. Sorry about that. Dana, the people that came in from out of area, they were tested upon their return. I guess I'm wondering if you had to do any contact tracing for them.
So when people return to the state, they should be tested. But I believe the people that we know of first had symptoms, and we had one other person go to the doctor as well. So that's how we found out about it. Most of the cases we've been seeing in the last month to 2 months have been asymptomatic.
Okay. And the contact tracing, did you have to do that for?
So
people
once, yes, so once somebody is positive, they are a case, then we do contact tracing to see who they've been in contact with. I would also like to state, we have a few people who are not from St. Lawrence County who are currently here from other states that have been positive. So we work like through their isolation process as well, but they're not counted in our county.
Thank you.
Mm-hmm.
Any further questions? Yes, go ahead, Mr. Akers.
So Dana, we're hearing reports that Bassmasters in St. Lawrence County may be or is canceled. Can you speak to that, please?
Yeah, so last week, about midweek, we heard that the tournament for the Cayuga County had been canceled. And we spoke to them on what were the circumstances just around that. When we had spoke with Bassmasters and we had a work group meet the Friday before, which I think was the 3rd, we came up with a plan to test them prior to them coming to St. Lawrence County. So as an athlete coming from another state that is from a high case area, you are required to be tested once you get to New York State. So they were going to be tested down in the Cayuga County right when they got here. They would be there. They were supposed to come in like around the 9th or the 10th. And then they would have been tested again after their competition. So they would have spent about 10 to 12 days at least down there prior to coming to St. Lawrence County. And when we had that conversation with Bass, we asked that they would be tested again prior to coming to St. Lawrence County, because like I mentioned last week, when you're tested in the first few days of that 14-day period, it's not always likely that you would show a positive test, although you may be positive. So that second test put in a safety guard for us, just to make sure that those individuals who may be traveling from a high case area, would not be positive. With the cancellation of that tournament, that took away all the extra time, and that second test we could do prior to them just just coming here to St. Lawrence County. So after lots of talks with them, there was not a way that we could put a safeguard. And so I believe today, and maybe Ruth or the group could speak to this, but I think I did hear that just today, the tournament was going to be canceled for St. Lawrence County.
And so, Mrs. Doyle sent us out an email on Sunday saying, it was an email from Bob Hegman, I think is that how you pronounce his name, the county executive for Jefferson County. And Bass is actually looking to have the tournament there. Can you speak to that?
So I just heard about that this afternoon. So I believe they're holding it there. I'm not sure what procedures they're putting in place to test the anglers. I know there's been some conversation of what they're doing, but I don't know if they're just testing when they get to New York State. I don't know what I'm not sure.
Have you had conversations with the public health director in Jefferson or Cayuga County concerning the Bass?
Yes, I spoke to the director in Cayuga County, and on the day that I spoke with her, she was not sure what was happening, but she had been asked to assist to do the testing. And when she was asked, I believe there wasn't enough time for them to arrange the testing. I have left a message for the public health director for the Jefferson County this morning, and I did not hear back today.
Okay, thank you, Dana.
Ms. Kern.
Dana, the New York State standard for athletes coming in to participate in any sport here is that they just be tested within the first 24 hours that they arrive, correct?
Yep.
So we were asking them to go above and beyond the New York State standard to come here to our county, correct?
Yes.
And they most likely will just have to adhere to that standard to go to Jefferson County, correct?
Like I said, I don't know what the procedures are. I don't know what they put in place. I don't know what the conversations were. I just learned this afternoon that they were going to go there.
I would like to look a little bit more into how we weren't able to get that together at some point.
Any other questions? Dana, yes, go ahead, Mr. Burke.
On the other side of that equation, that Rita brought up, I'd like to commend you and Dr. Williams, first and foremost, for taking steps that are reasonable to keep our citizens safe. So thank you.
Any more discussion? Okay, thank you very much, Dana.
Yeah.
Oh, yes, wait, Mr. Akers has a question. Hang on just a second.
So my question isn't for Dana, it's for Mrs. Doyle. Have you received or are you attuned to other information concerning this tournament?
In what regard?
What Jefferson County, is it going to take place in Jefferson County?
Bassmasters has just shared an announcement that it will take place in Clayton.
Thank you.
Okay. Anything else? Nothing else on the screen? Okay, thank you, Dana. We'd like to check in with Dr. Williams now. Is he available?
Yeah, I'm here.
Go ahead, doctor.
So I did want to just kind of underline some of the things that Dana said and also give kind of a bit of a national perspective. I do think that as we move forward, we've already talked and people are aware that the first wave has kind of come through New York State, not hit us too much, at least initially, and has moved southward and southwestward and westward. Some of what Dana shared, however, does indicate that we have people who are returning to the community from these high transmission regions, and I would still argue that that's our biggest risk. I think our focus from public health really has to be on what I would call the reopening rollback prevention program. And what I mean by that is we've made great strides, I think, because of lots of sacrifice on the part of people in the community, business owners, religious organizations. People have really generally, followed the guidelines, and we've been able to largely reopen the economy. However, I think if we make missteps, what you're going to see is in New York State and possibly in St. Lawrence County that we could have a rollback of the reopening. And I bring this up partly because if you look at California, which initially had done very well, they just announced this afternoon that the governor made an announcement that they'll be closing all of the bars in California and that they're banning indoor dining. So this is an example of a large state like New York State that had made some progress, but because of significant setbacks, has had to, again, sort of shut down at least part of their economy. They also announced that the largest school district in California is going to do remote-only instruction starting in the fall. So that's just sort of, I guess a cautionary note that we need to do everything we can to prevent compromising the significant forward progress that we've made. Along those lines, I did want to just reaffirm that, there are certain things that community members can do. There's what I had been calling the 4 pillars of community response to the pandemic. After some debate, I actually think it really should be 5 pillars of community response. And I promise you that by the time I'm done, there will not be 25 pillars. It's just going to be 5 pillars. But again, wearing a mask, socially distancing, washing one's hands, and then staying home if you're sick. The 5th pillar I put there, which I think is very important, is to avoid unnecessary travel. And that I think is going to become increasingly important. I think when you look at what's happening or what could happen in New York City, we could basically have a rubber band where we made this great progress. And then if we have people from Texas, Florida, California, Arizona, all the states that are now at high prevalence, if they all come back to this state for whatever reason, we really do risk compromising the significant progress that we've made. I am going to mention testing. Dana already noted that we've done just slightly more than 21,000 tests in the county. There are still, testing is more widespread, but there are still challenges. For anyone who's recently been tested, you may realize that the turnaround time for the send-out tests, which had been sort of in the 24 to 48 hour range, is now in the 3 to 4 day range. The other question that we've talked about before is of expense. So there's really a lack of clarity, but in general, people who are being screened, who are asymptomatic, for the most part, the burden of the cost either falls on their employer, if it's for employee-related screening, or potentially on the individual. So especially as we look at more extensive testing, I think the expense clearly is going to be a burden for somebody, whether it's a burden for the insurer or for the individual or for the employer. So that will be something we'll have to keep an eye on. As far as in-house or point of care testing, the main hospitals in this community are offering this, but only on a limited basis because of a lack of reagents. So there are 3 appropriate point of care tests, and each of those manufacturers is working on increasing their ability to distribute the reagents to us. But as of yet, there's a real limitation, and that continues to be a concern that requires us to steward the use of those tests. There was a news release that one of the academic institutions in New York State is trying to get FDA approval for a batch saliva test. And so when we were talking before about doing widespread screening, particularly for university students or for maybe like a nursing home setting or a large employer, the idea of having an approved batched test would really be tremendously helpful. It would both help with the economy of doing the testing and the efficiency. So that's not yet FDA approved, but when it is, I imagine other tests like that will follow. And from a public health perspective, we'll make sure that people have access to that in the community. The final thing I want to mention is that there's been a lot of discussion about the universities safely reopening. That will continue to be a focus. Right now, the primary and secondary schools are also looking at what their safe reopening plans might look like. Just today, the New York State did release the preliminary guidance, the preliminary interim guidance on reopening of primary and secondary schools. I think what you're going to find is that throughout the county, the superintendents will be meeting with individuals in their districts and then also coordinating with public health to come up with a plan that makes the most sense. Right now, between today and when both the universities reopen and when the schools reopen, I kind of feel like a lot of us are holding our breath, hoping that there isn't a large surge of cases in New York State. Because as we found, if even though there's some regional differences in progression through the phases, I think if there is a significant increase in cases throughout the state, again, we could jeopardize the reopening, and we might compromise the ability of the schools to open, which I think would be unfortunate. So that's the update that I have. If anyone has any questions.
Mr. Forsythe.
Thank you, Dr. Williams. Is it true that anyone that wants to be tested can be tested? And if so, how do you go about doing it?
Sure. So I've tried to promote the concept of people being able to be tested when they want to be tested for some time now. However, it wasn't until July 2nd, I believe, a new interim guidance came out from New York State Department of Health that made it official, that I believe the term is that any New York State resident is able to be tested should they desire to be tested. So now there's the practical matter of making that happen. And St. Lawrence Health System has 4 testing centers, and Claxton Hepburn has 2 testing centers. They have a respiratory clinic. So the primary way that people should go about getting testing would be to contact, there are 3 numbers actually, one for St. Lawrence Health System, one for Claxton Hepburn's Respiratory Center, and then one for public health. But if they contact those numbers, they should be able to get tested. There is still a screening process and an appointment needs to be made right now. So it's not like you can drive up somewhere and just announce that you'd like to be tested. It does need to be done on an appointment basis. And I would encourage people, certainly the legislators, if they hear of people who are having difficulty with that process, everyone really is trying to do their best to make this available. I'm happy to troubleshoot or to provide feedback to the people who are directly running these testing centers. St. Lawrence Health System in particular, which I'm a little more directly familiar with, has essentially a new director of the testing centers. And he's excellent at customer service and organization, great organizational skills. And I'm hoping that what you're going to see is that the kind of customer service aspect of this will continue to improve. And I imagine it's the same for Claxton.
Thank you very much.
Mr. Burke, go ahead.
Dr. Williams, do you have any update on the antibody testing? And at one point they said that there was a possibility of having a finger prick test that you could read at home. Any update on any of that?
Sure. So antibody testing is currently available throughout the county. St. Lawrence Health System, I know, is going to probably provide it in-house. And the only thing I would say about the antibody testing is, as we've talked about, the antibody testing is relatively less useful compared to the what we call either the PCR testing or the antigen testing. So the antibody test provides evidence of a prior infection or an infection that's been there for at least 10 days or so. So it has utility if you're looking at the epidemiology of a disease community. So for instance, we earlier in this pandemic tested about a little more than almost 600 people in the county to just see how many people had antibodies. That's a kind of test that could be done again, or a kind of study that could be done again, but it's for epidemiology. For an individual, what it would tell you is that you had been exposed to the virus in the past, and that most likely you had recovered. The real question for this is, again, initially there was discussion about, having immunity passports. So if somebody could demonstrate that they had antibodies, you could say they don't need to take the same precautions as other people do. However, within the medical scientific community, there's still no evidence that people have sustained immunity. And so we don't recommend issuing passports or things like that for people who are positive on the antibody test. Concerning, finger prick or other ways of collecting specimens, I think, people are keenly interested both for the PCR and for the antigen testing to figure out a way to collect the sample other than, sticking a ramrod in the back of your nose. So people are looking at collecting samples from the front of the nose, which is less invasive, and also saliva samples. And I think what you're going to see is that the less invasive manner of collecting the specimen will become more prominent. And once that's been validated to be effective.
Thank you.
Yes, go ahead. Tony?
Yes,
Okay, there you go.
Thanks, Mr.
Go ahead,
Chairman.
Tony.
I appreciate that. Thank you. And Dr. Williams, thank you for your report. And, I know that the scope of and the primary objective of both you and Dr. McGuire's work is to keep the populace safe here in St. Lawrence County, and are certainly our leading medical advisors, and no unnecessary gatherings, which is why I'm not at the boardroom tonight. But I know economics are not the primary objective of you. Getting back to the Bassmasters, to a degree, this is new information, obviously, for us, and it's pretty big. And if the announcement had have been that the Bassmasters was not going to be in St. Lawrence County, it was not going to be anywhere in New York State, I think that would have been palatable. That it would have been the guidance of the state that it shouldn't happen here. But the fact that it's going to another county, and also the fact that, if I'm wrong, correct me, Dr. Williams, but I believe that the state's guidance provides minimal, protection to a degree, with oversight from the counties. So is it possible that we appear to be ill prepared to the Bassmasters, that they would choose to go to one of our adjoining counties? In your or Dr. McGuire's opinion, how could this happen? How could they choose, not to have it in New York State, but just have it one county over from us? Could you help me understand that?
I guess what I'll say, having been somewhat peripheral to the discussions, is, New York State is like many states, is, there's sort of the central state, and then and central New York State Department of Health, and then local health departments. I think there's sort of a balance between the input that local health departments and New York State Department of Health put out there. I don't have enough information to comment on, what Jefferson County may be thinking. I will say that there's varying levels of expertise in understanding testing and understanding this disease. And I suppose it's like many situations where you could probably keep asking different states or different counties within a state what their comfort level is with something, and you might get different answers. And I don't say that flippantly. I don't have enough information to know more than that.
And if I could just add here, while the state has like the minimum standards, local health departments are free to add kind of any additional things that they feel might be necessary just to keep the population safe.
One thing I'll say, and I've mentioned this before, I mean, I feel strongly on this case and this situation, or in situations in general, that I think we create what I would call a false dichotomy between public health and economic health. From a public health perspective, there's a tremendous amount of information about the negative impact that socioeconomic factors play in people's long-term health. So although I guess my role here is to mostly advise on the specifics of the kind of the medical details of public health, I would speak for Dr. McGuire as well, that we're both cognizant of the fact that if this economy were to continue to suffer for a prolonged period of time, that will in and of itself have a profoundly negative impact on the health of the community, the physical health of the community. So we understand that those things are intertwined, and hopefully make intelligent consultations with that information.
If I could follow up, please, Mr. Sheridan.
Yes, go ahead.
Thank you. Well, and again, I am not in any way looking to point blame, but there are a lot of strong supporters of this event that are going to be looking for answers as to, how we as legislators, would allow this to happen. And I just want an understanding of how to respond to the constituency when that question arises.
Sure.
Mr. Burke, did you have a question?
Well, I do. Margaret was ahead of me.
Okay, Margaret, I didn't see you first. Go ahead, Margaret. Ladies before gentlemen.
No, that's okay. I changed my mind. Please go ahead, John. Thank you, Mr. Chairman.
Go ahead.
I wanted to ask the question of Dr. Williams. I think the word they use is penetration of the virus in the community. And I guess I'm wondering how vulnerable, but do we know how much this virus has penetrated our community, and how vulnerable does that make us if we do know, or if we don't know?
Well, I guess there's a few different ways to look at that. I mean, on the one hand, we're fortunate in that I think the prevalence of the virus in our community is relatively low. So that's fortunate. And that means I feel like we sort of dodged the initial bullet largely, although certainly out of respect to, there are people who've died of the illness in the community. So out of respect to them, I don't want to diminish the degree to which the virus has been in our community, but we've done relatively well compared to other parts of New York State and compared to other parts of the country now. However, that means that we're, I think we discussed a little bit the concept of herd immunity. Whatever it takes to have herd immunity, it's at least 70% of the people being affected. If you're at like 0.7% of the community having some form of immunity, we're incredibly vulnerable. So it's a blessing that it didn't strike us hard, but it's potentially a curse, because if it should come back, there are very few people who have any immunity, if immunity long lasting actually exists.
Thank you.
Any further questions, Dr. McGuire or Mr. Williams? Dr. Williams? Go ahead, Mr. Rakers.
Thank you. Well, hindsight's 20/20, and mistakes have been made, and I don't blame anybody anywhere, whether state, federal level, or county level, or anything, because it's a new disease or a new virus, and it's good that we're being careful. What we should have done as a public health board was when leaders of the communities that were saying that it's okay to protest and to demonstrate, that's more important than the COVID, that I think that we should have fashioned a statement to the contrary. There was 1,300 doctors on that list that said it was more important to protest against racism than to worry about the COVID. Did St. Lawrence County Health Systems or the Public Health Board, well, not the board itself, as directors, did they think about fashioning a statement in contradiction about the necessary to be safe about the COVID? I would ask either Dana or Dr. Williams.
So I'm not familiar with the the statement that you're referring to, the 1,300 physicians. What I would say is I feel like, my position and the position of the board has been fairly unwavering in trying to promote what I'm previously promoting the 4 pillars, now promoting the 5 pillars of the community response. And I think whether one is protesting or whether one is attending religious service, I think I feel strongly that those 5 pillars are important, and I certainly hope that people take them seriously and implement them to the best of their ability, whatever the context is.
I think the article, I don't know if I saw it on North Country Now, it was a New York Times, I think it was a New York Times article that had the 1,300 names. And I actually looked through the names to see if I could identify any of them as being local doctors, and I didn't recognize any of the names. So you're saying that you were not aware of that statement that 1,300 doctors signed?
Not until you just mentioned it. And, I will tell you that aside from the issue of the protesters and things like that, as a medical professional who walks into the hospital every morning and wants to walk out healthfully every evening and goes to my community health center, generally medical professionals are feeling very stressed and exhausted and are really desperate or maybe even more desperate than everyone else for this to be over. And so I think most people in this medical community support any effort that would help this pandemic end sooner rather than later, aside from politics.
Yeah, thank you. And I don't want to be political, but you can see how the public is confused, that it's okay to do one thing, but not the other. Yeah. And I think, and that's why you're getting some pushback. I think that's why you're getting more reports. Either people are more highly sensitive to it and calling our hotline, or, or they're just basically saying, you know what, we've had enough. I think so far here in St. Lawrence County, from what I've seen in the businesses that I have visited, that mostly people are complying. They're wearing a mask in the stores. We're not seeing a lot of social distancing on the beaches where I have been, practically zero. And I think the average age in Florida, I think I heard the governor say, is actually 21. And that age bracket does not seem to be vulnerable. Certainly they're not completely safe, but I think the emphasis on keeping our most vulnerable protected is probably the most important. So.
Mr. Lightfoot, go ahead.
For Dr. Williams, Doctor, can you explain to the board here the purpose of each of at least the 2 tests that I'm familiar with, the PCR and the CLIA, the CLIA sanction test? And what's the purpose of each test, and what results are shown, once the test is completed? What results are given to the physician to use in his treatment process?
So when we talk about these tests, I actually think of them as there's really 2 categories. Well, there's really 3 categories. So there's antibody testing, which is the blood tests that we talked about earlier that show that you have developed an immune response to the virus. And that's useful just for epidemiologic purposes. And then for determining whether somebody's acutely ill, there are 2 basic categories of tests. The CLIA test, which I think is the term you used, that actually is not a test. It's not a particular kind of test. It's a law which allows clinics to do certain kinds of laboratories in different settings. And specifically, there are tests called CLIA waived tests, which allow health centers and private physicians to do a particular test in their office. So when we talk about CLIA testing, that's not a particular test. That's referring to the legislation that allows people to do the test. So in terms of the acute testing that's done, there's the PCR testing, which is also called molecular testing. And that's looking for the actual genetic material that's part of the RNA from the virus. And if that's positive, with a fairly high degree of certainty that tells you that somebody has COVID-19. If the molecular/PCR test is negative, that also tells you with a sufficient degree of certainty to make public health decisions or to make care decisions that that patient does not currently have an active version of that infection. The other kind of outpatient test, which I think is maybe what we mean when we're talking about a CLIA test, is called that, some people call it an antigen test, because it's not testing for the genetic material of the virus. It's testing for like a protein, like a glycan, that's part of the virus. So it's sort of testing for a particle of the virus. With that test, however, if it's positive, you can tell someone with a fair degree of certainty that they have the disease. However, if that test is negative, the recommendation from the manufacturer, from the FDA, from the CDC, from the Association of Public Health Labs, is that you have to confirm that negative test with another test, like the PCR molecular test. So it's specifically not for asymptomatic people, and it's specifically not for public health screening of asymptomatic people. So if you look at what the manufacturer says, what the CDC says, what the FDA says, what the Association of Public Health Labs say, if that test is negative, you're not supposed to make public health decisions or infection control decisions based on that negative result. You're supposed to retest the person if you think that's clinically necessary. So that specific test was the first test that was approved. And so it's out there in certain community settings, but we don't use it at the hospital. We don't use it at my health center. We don't, Samaritan doesn't use it because it's really just appropriate for like an urgent care setting where somebody has symptoms, which increases what we call your pretest probability, which means that a positive test is more likely and that a negative test may be more meaningful. So some people mistakenly think that you can use that for screening of asymptomatic people, but if you look at the manufacturer's instructions and everyone's understanding of this, that's not the case. And I'm sorry, that was maybe more complicated of an answer than people were interested in, but. So it's basically, I guess what I'd say is like in medicine, there's lots of tools that we use for different things. There's diagnostic tools. I think there's some people who see a doctor and they feel like they really should get an MRI. Well, sometimes the MRI is not the right test. A CT scan is more appropriate or an ultrasound is more appropriate. So in public health, there are tests that are used for certain things. Just like when antibody testing came out, I think everyone said, oh my gosh, I have to get an antibody test. Then people realized what's useful about an antibody test and what's not useful. So so that's my explanation of testing of people who are with those different testing modalities.
Thank you, Doctor.
Any further questions? No more further questions. Thank you very much, Dr. Williams and Dr. McGuire.
My pleasure.
Now we'll go on to resolutions. For public health, we have a resolution authorizing the chair to sign a contract with Health Research Incorporated, HRI, for COVID-19 response and modifying the 2020 budget for the Public Health Department. Do we have a motion? Motion by Mr. Akers, seconded by Mr. Lightfoot. Go ahead, Dana.
Thank you. I had brought this just a little bit earlier, I think back in March, to accept the funds. We now have the contract from HRI. So this is just to authorize the signature. Just so you know, what this grant supports is all of the response activities. So our department has been working hard all days of the week. So we have a lot of overtime. So it pays for the salary. It also pays for some of the supplies we need. So when people, if they're on an isolation or on the quarantine, if they need things at home, this pays for it. When we do use the external quarantine site, this pays for their stay. It pays for like any food that they need. And so that's what these funds are for. And to date, we have used about 50,000 for the response activities in the categories that I just spoke about.
Any questions for Dana? There'll be no questions. All in favor?
Aye.
Opposed? Carried.
Bill, you turn on your mic.
Keeps going off. It's off again. It's off again.
At the other one.
The other one? There you go. Technology. We have another resolution for public health, claiming August is National Immunization Awareness Month. Do we have a motion? Motion by Mr. Fay, seconded by Mr. Forsyth. Go ahead, Dana.
Thanks. We just bring the awareness of vaccinations that we have. And I just wanted to highlight for last year's school year, we did vaccination of 240 kids. This year so far, for the 19-20 year, we have vaccinated 190 kids. And so we had a 3-month period where we were not doing vaccinations. So we are trying to make that up. But all families who need vaccinations, who can't get in with their primary care, or that still need to be linked to a primary care, we help them do that, and we do the vaccinations for those kids.
Any questions of Dana? I see no questions. All in favor?
Aye.
Opposed? Carried.
Thank you.
Now for social services. Thank you, Dana. For social services, are you going to address that, Ruth? Okay, we have a resolution authorizing the chair to sign a contract with Hillside Children's Center for recruitment of adoptive families for children in foster care. Do we have a motion?
So moved.
Okay, Rita Kern, seconded by Dan Fay. Go ahead,
This
Ruth.
resolution, there's information, your social services statistics are loaded onto Google Drive, and I mention those because in that data, there's information related to the number of children available for adoption. And so that is an area where Hillside Children's Center is helpful to us. That number currently is 5. And there is no cost to St. Lawrence County associated with their involvement. If you remember, we started doing this, I believe, about 2 years ago. And they have been helpful to the county.
Any discussion? Margaret, go ahead.
Thank you, Mr. Chairman. I'd like to state that I will recuse myself from the discussion and voting on this. Thank you.
So noted. Any other discussion, questions? Mr. Smithers, go ahead.
I'm not familiar with this, maybe the rest of you. Could you tell us where this is and what the location, is this in St. Louis County or where is?
I don't believe that it is. I can get you some more information about that. I believe that it was in Rochester, but I would like to check on that and share that with you.
Thank you.
Any further questions? All in favor of the resolution?
Aye.
Anyone opposed? Carried. Thank you, Ruth. The next resolution is, there's not a resolution, but Jay Ulrich will be having a monthly clinical update information. Go ahead, Jay.
Thank you and good evening. I believe you have the June handout for the community services updates. As you can see, the no-show rates remain relatively flat. Did have a half of a percent uptick. I think, we're going to have a little fluctuation in our no-show rates. Hopefully, they'll continue to remain around 13% or lower as we continue to move forward. The clinic counselor visit average, again, went up slightly. The aggregate number last month for all clinics was 4.99. We're currently at 5.18. The chemical dependency visits per hour per 7 hours also just hedged up slightly. It was 3.4 2 months ago, 4.1 last month, and 4.4 for June. The mental health visits remain strong in terms of their visits per 7 hours. We're right now, the average is 6.90. Last year was 6.84, so just a slight increase. And again, that doesn't, some of these are going to be 30-minute sessions. So that's why they're able to see almost 7 people in a 7-hour day, because there are 30-minute sessions mixed into, those combinations and permutations of the visits. So chemical dependency weighted face-to-face last month was 55.23. So they're currently at 58.8. And again, the goal is 72%. So we're still have not met the goal, but we're moving the needle slightly in the right direction. The mental health weighted face-to-face, again, slightly increased. Up to 76.3% for the month of June. On an aggregate, certainly the mental health is, done, very well, with their number of visits per day. So an approximate aggregate, percentage of face-to-face visits right now across all clinics is approximately 65%. Of face-to-face billable hours. Moving on to the second page, the prescriber visits were pretty much flat. Last month it was 9.98. This month it's 10.2 visits per 7 hours. There is a little difference in the distribution. The 792 position is our full-time nurse practitioner. Her numbers went up slightly because she took on some additional waiver people, some MAT from this chemical dependency, because the locum tenens was getting close to her limit, which would be 100 patients that she's able to serve in the provision of Suboxone. So when we made the shift, we put some new folks in the locum tenens person schedule, and they typically have, the first time appointments typically have higher rates of no-show, so that explains why her numbers went down. But again, it was, relatively flat from last month. We continue to not have any waiting lists. There was a slight increase in clinic services in April as opposed to March. And percentages of billing is pretty much remaining flat as well. Are there any questions?
Mr. Burke, go ahead.
Jay, is this just relevant to the productivity or any questions in general?
Well, I have some other things I'd like to update you on as well.
I'll wait then. Thank you.
Any further questions on what has already been presented? Okay, Jay, no questions. Go ahead and give us your other updates, please.
So at the end of last week, both OASIS and OMH announced what they called state aid withholds. And they're calling them withholds because they're hoping that there's going to be some federal stimulus money that comes from Washington to help out state and local municipalities with dealing with the COVID piece, as well as just the struggling state budget. So originally, they both announced a 20% state aid cut, and OASIS later came back and it was actually a 31.1% state aid shouldn't say cut, it's a withhold. We're keeping our fingers crossed that, that the providers will be made whole eventually if we get the federal stimulus money. Of course, that's not a guarantee. But what that means to community services on the OASIS side for the third quarter is a decrease in state aid of 27,000 approximately. We're just working these numbers out, but fairly hard number is $27,253 that we will not get for state aid for our chemical dependency clinics. And then on the OMH side for community services, I'm talking about the clinics, not community services as a whole, just the clinics. We will be receiving $29,018 less in this third quarter. So an aggregate withhold of $56,271. Again, that's approximate. So I just wanted to let you know that it's not fun times right now. As that, so we're gonna see if there are some surpluses from some of the state aid. It gets a little tricky moving these monies around depending on the fund code and the program code. Some are more difficult to move around than others. But if we can find surpluses that are not being used from January 1st to date, we're going to try to ask the O agencies if we can move some monies around to support not only community services, but also the other providers. Any questions on that? Okay, thank you. So the last thing, I wanted to give you an update about the RFP that the Community Services Board initiated a while ago. The due date for submission to that was July the 6th. There are 3 agencies that have responded, those being St. Lawrence Health Systems, St. Joe's Rehabilitation Center, and the Community Service Chemical Dependency Fund. On the 15th of July, which is coming up this Wednesday, the CSB is going to have discussion and deliberations and begin scoring those. They do have an opportunity if they need more time to ask the providers additional questions. They'll have 5 additional days to reach out to get some questions answered if they have any. The final decision is going to be July the 20th. So the plan after that announcement is made is to have the Community Services Board chair and hopefully one other member of the executive committee report to the Community Services Board of the decision made by the CSB. Because of our involvement, in making a response to the RFP, I will not be involved in any of those deliberations. And we'll leave that solely up to the CSB. We are asking Suzanne Levin from Franklin County to be on that Zoom meeting in case there's any technical questions or clinical questions that the CSB may have.
Any questions of Jay? Mr. Burke, go ahead.
Thank you, Jay. The decision as to who receives the methadone clinic, it's a fairly significant decision. It's my understanding that it would be a pivotal point for county services. That I read your proposal. I read all 3 of them, and I think that the county did a great job in presenting the narrative. But with the county taxpayers have lost money because of entities coming from outside of the county into the county and providing services, namely St. Joe's and Citizens Advocates. This would further erode our client base because, my understanding, and you can correct me if I'm wrong on any of these, Jay, my understanding is that this is kind of a package deal, that when you provide methadone treatment, you typically provide other ancillary services, counseling, and I think you have to provide some level of physical care or physical assessment as well. So it's a package deal, so that if somebody else gets this other than the county, there will be a further erosion of clients that we now see, we now serve, and a further loss of revenue for county taxpayers. You know, I know that Canton Potsdam Hospital just got a boost of millions from the COVID, and much needed, I might say. But the projection of revenue for this methadone clinic in the second year is approximately 1.4 million. It would help stabilize the cost of running both the mental health and substance abuse clinics, both of which are very much needed in St. Lawrence County. And so there's a direct link to taxpayer benefit. And I guess I'd just like you to maybe comment on that, Jay, and give me your assessment.
Well, I think, we have, upwards to 30, maybe a few more patients that are receiving our highest level of care that we now give, which is Medicaid-assisted treatment, that being Suboxone. So usually when someone's on Suboxone, they do get a lot of ancillary services, as you mentioned. They attend group, they get individual counseling, they get peer services, in addition to being seen by the prescriber on a regular basis. So, I haven't run the numbers, anecdotally in terms of if we lost 30 patients that had a need for a higher level of care, that being methadone, what the financial impact would be. But, as you can see by the monthly numbers, we still, have some ways to go in terms of having the counselors meet the production standards. So this would certainly take it in a different direction if we did not get the OTP. Sure.
Thank you, Jay.
Mr. Forsythe.
Yeah, thank you, John. You make some good points on that. The only thing I don't want to get lost in the shuffle here is you have the monetary amount is important to the taxpayers, but I think the quality of service that can be provided is the utmost. That's going to be where my focus, I know my goal is going to be, who can provide the best care, and we'll go from there. Thank you.
Thank you.
Any other discussion? No further discussion? Okay, so thank you very much.
Thank you.
Jay.
Yeah.
Well. Next thing is vacancy review committee. Do we want to discuss that at the next meeting, or?
Nope, I'll go through them now.
Go ahead.
So I'll provide you with a summary that was in all of your agendas, and then I will also speak to the positions to be considered for social services tonight. This month, we conclude the year. If you remember, the Vacancy Review Committee was started up again in August of 2015. And so each year, we count the time from August to August. So this year, as we're wrapping up July, we'll start the new in August. There's been 123 positions. Now that's 45 fewer positions than last year at 168, or 73% of positions considered. This month, you'll have 12 requests from 8 departments, and 2 are on this agenda. There are also, as agreed upon, positions that are part-time or probationary that I've been able to discuss with the department head and move those forward. I wanted to report to you that since we last met to review vacancy review in June, part-time positions for nutrition services aide and a part-time dispatcher were filled or authorized for fill. Also, a deputy sheriff and a probation officer who did not complete probation have also been reauthorized for fill. That being said, what we're looking at on this agenda differs slightly from those that you've seen because there are starting to be some 90-day requests. So looking back at how some positions have been filled or have been left vacant, it may be possible for departments to leave the position vacant for 90 days. And so by the time it's approved at the August meeting, close to 90 days or thereabouts has elapsed. What we'd like to do is be able to capture the time vacant for positions in each department and be able to give departments that credit for those positions having gone vacant, to make you aware that they've gone without that position as you consider their request to fill. So that being said, we have on this summary for the entire month, 3 that are moving forward with 30-day recommendations, 1 with a 60-day recommendation, and 4 with 90-day recommendations for holding to fill. There are none that are moving forward from the Vacancy Review Committee for immediate fill. 1 has been held for reconsideration next month. So just to give a little context for our new legislators, the Vacancy Review Committee rotates between legislators each month so that 2 legislators are given the option to attend the meeting and participate in the discussions with the department. That provides an opportunity for everyone to participate in the process, but it's also staffed by myself, Human Resources Director, my Assistant Administrator, Payroll, so that we have a good dialogue and discussion about each and every position to be filled. And when those are recommended, that's when you'll see them move on to your agendas for consideration. Any questions on the summary?
Which one
Go
was?
ahead, Mr. Burke.
Probation?
Ruth, I'm wondering where we stand on items for social services. Are we, you know, I know we've had discussions before, and I'm just wondering where we stand on vacancies and are any of those positions being held?
No, they are not, John.
They're not.
I believe a caseworker assistant was just hired last week that you had previously authorized. And then I will, once questions are resolved on the summary, go through the 3 to be considered for tonight.
Okay. Just wondering, Ruth, do we have a fairly good recruitment process as well? I mean, do we have people so that when positions become open, do we have people lined up for that? And I'm thinking, you know, some of the more critical positions that we might feel need to be filled. I'm just wondering about availability of people to fill the items, and I'm wondering if you can comment on that.
So the line is queued up, but it's in the form typically of a civil service list. And so as many of you have heard, exasperation over the years with moving through that list in groups of 3. Once someone declines, you can move on to the next group. That creates challenges with the timeline of getting the position through the process, approved, and then the canvas process through civil service. But traditionally, the positions in social services you're referring to have established lists. And if you recall with the caseworkers for CPS, we even increased the frequency with which we give examinations. So it used to be that we give examinations every 2 years, and we've moved to every year. So that can, in some instances, provide for more candidates because there are 2 lists. So you'll exhaust one and move to the other. So it's infrequent that there's not a list, and in that case, that allows us to go, the phrase that's used is on the street, and to open that opportunity up to the public without prior civil service examination results in hand. So they're given an appointment that is provisional until they can sit for that exam. So in most of these cases, and John, I'm happy to look up the titles if you'd like to see where the lists are, as far as which have established lists, which do not, and if there are any that we're having particular trouble recruiting for. Does that answer your question?
It does, and I guess I'm just wondering, Ruth, are we still only canvassing the top positions on the civil service list versus a broader scanning or a broader search for candidates? In other words, do we just take? Are we still just looking for the top 3 positions, sending out a canvas letter, or are we doing maybe the top 10 scores, realizing we still have to appoint from the top 3, but it cuts down on the delay?
I would answer that by saying sometimes, and I'd qualify that by saying that sometimes one of the scores may have multiple names associated with it. So that would allow an additional amount of folks to be canvassed for the position. So I assure you that Human Resources is getting as many, following civil service rules, but getting as many notices out, because the quicker those letters are returned with either interest or declination, we can continue on the list. And once approved, I assure you departments are very interested in getting a group worth substantial enough to conduct the interview process.
Yeah. Well, again, I guess I'm not sure, Ruth, that maybe I didn't word that correctly, but we can send out canvas letters for more than the top 3 scores, which would give us a broader, so that if the top 3, if 2 aren't suitable and the third one declines, we can move right down into the next score list and prevent any delays in filling critical items.
John, if it's okay, I'll have Johnny give you a little more specific information. Johnny?
Okay.
Hi, good evening. So John, we do often give extended lists, and that's what you're referring to. We will often send an extended list if the lists are short. So we can many times send the entire list. If there's only 23 names on the entire eligibles list, we may send that entire eligibles list to them. And we're very confident with social services, especially, and Danielle Burke. She's very good about following the rules. So we really know that we can trust that we can send that extended list and be sure that she's following directions. So we do that whenever they request it. And we also, I just wanted to just kind of follow up on something else that Ruth said. We actually started giving exams twice a year, and we can't give them any more often than that because we have to have a 6-month waiting period. But we started giving exams twice a year starting, I want to say in 2018 or the beginning of 2019 for recruiting purposes.
Good, thank you.
So we do lots of times, we will have 2 lists that are going at the same time. And yes, they do have to get through that first list before they can go to the second list. And then if there's not a lot of people on that first list, as soon as the time frame kind of wears off, we will expire that list. But we don't expire the list unless there's not very many names on it or very good candidates.
Yeah, thank you.
Any other questions on the summary?
Any more questions?
Okay, this question.
So minor correction, I'm listed in the March meeting correctly, but on the July meeting, I'm listed as Dave Fay.
Oh.
Appreciate the feedback for staying.
We can do that. Apologies.
Any more discussion on the vacancy issue? Thank you.
So for social services this month, the first item for your consideration is the social services attorney position. That position became vacant last Friday and is the longest tenured employee in social services will be departing us. So the request is to, as quickly as possible, and if approved this evening, to go ahead and begin the advertising associated with this position to hopefully get another attorney in as soon as we possibly can. The last resolution you approved for social services attorney has now been offered and filled with a start date of August 3rd. Also, I expect very shortly you'll hear from General Counsel from DSS with a review that he indicated he would provide. Any questions?
Mr. Burke, go ahead.
Ruth, how long had that attorney worked for us? That
I
just
believe
left?
2.5 years.
2.5 years?
I believe so, yes.
Yeah. Do we have exit interviews?
When we have cooperative folks, we sure do. If
Right.
they return our calls or they'd like to speak up with us, we absolutely do.
Mm-hmm. It would be good to know. I don't know. You know, in a previous employment, we used to review not with names attached, but we used to review comments as to why people are leaving, or because lots of times you'll get a little, you'll get some information that's relevant to the organization. Is that possible to see comments without names attached to it?
Yes, and Johnny, would you like to speak to how you collect that information and maintain it?
Sure, I do gather the information. I do put it in a general spreadsheet, and so that all department directors can see it. And I do actually have the couple of exit interviews from the social services department, that unit specifically. So we do have those exit interviews that we can share that information without names.
Great, thank you.
Any other questions on the social services attorney? Okay, the next one up this evening is the principal account clerk. And this is one of the positions that is extremely important in the fiscal unit in social services. The fiscal manager, as you recall, participates in the budget process and really heads up that entry and review. However, this position has been a position that's worked mostly on submitting the claim. And by the claim, that is how we're able to prepare and plan for our budget process. We submit that claim to the state in a test form. It comes back, we're able to make modifications, and that process is cumbersome. And I think the person who has vacated this position has remained internal with us, working over with WIOA. So she actually has been coming back to work a few hours per week to assist the fiscal manager. So it's our hope that we can fill this position as well. Any questions? Okay, and the last position in your packet this evening for social services is the deputy commissioner. And as you'll recall, the deputy commissioner assumed the interim commissioner on March 31st. So while the date is July, that position actually hasn't been occupied since that time. So that would also fall into the category of 90 days. It is my request that an update I'll provide you a little bit further on in the meeting. Once there is a commissioner appointed, that this position be able to be put out internally for staff as well as out into the public to collect information associated with those who are interested in the position, so that once the commissioner is appointed, shortly thereafter, they can get some help. Certainly this area in the past has focused on both children's services, child protective services, as well as Medicaid. And so we're looking at the best structure with both a new commissioner and a new deputy commissioner coming in to make sure that we set them up for success. So it's also my request that this position be filled. Are there any questions?
Mr. Akers?
Thank you. Ruth, on the previous sheet, you have your recommendation or is to fill immediately, or the recommendation is to fill in 90 days. Is it immediate or is it 90 days? The request is for immediately, Deputy Commissioner, but the recommendation is to fill in 90 days. This sheet says immediately.
Okay, so the request came in was immediately, so that's what they'd be requesting. But since it's been vacant since March, 90 days since it was occupied has passed.
So essentially immediately, but 90 days has passed.
Yes, since it was occupied. And that's what we base the vacant days, if we say 30, 60, or 90 is the last time that was occupied.
So these other positions, they could be in that same category though, even exactly, right?
We try to, when we can, if it's been beyond 30 days, we try to fill it with that recommendation, whether they're requesting immediate or not, so that you can see how long that position's been unoccupied.
Thank you.
Yep. Any other questions on social services before we go on to Youth Bureau? I believe Alexa is with us this evening. Okay. Just give her a moment to
I am.
have fun. Hi, Alexa.
Good evening. Hi. Hi, everyone. Good evening. Things are going well over here. Good. Hi. We are presenting our Youth Bureau Secretary 1 position. We had pushed this through last April as a full-time temporary. But with COVID restrictions and the fact that we have not been running YCC programs this summer, both Ruth and I felt that it made sense just not to fill it quite yet. Plus it was saving some budgetary dollars, which is always a really good thing. But at this point, our goal is to have Secretary 1 in position by fourth quarter this year. So the person's up and going for 2021. And so my timeline here, I realize it says 60 days, but I'd be looking to fill this position mid-September by beginning October would be the timeline. And this person will assist me in just daily operations of the Youth Bureau, helping meet deadlines and help with program initiatives.
Questions for Alexa? Okay. Thank you, Alexa.
Thank you,
Thank
Alexa.
you. Thank you.
That's it for vacancy on this committee. Mr. Chairman.
So move on to committee reports. We'll finish it. Committee reports. Mr. Akers, Board of Health.
Thank you, Mr. Chair. As you can see, that we've been getting the monthly or the weekly updates on the COVID. That's primarily what the Public Health Board has been considering. It's taken our full attention. So we're not talking about rabies or anything else. So that anything else are too hot conditions. So fully immersed in the COVID too.
Thank you, Mr. Akers. CDP Board of Directors, Mr. Lightfoot.
Thank you, Mr. Chairman. With regard to the CDP, they had to, because of COVID, shed some employees for a period of time on a temporary basis, but things are slowly working back into normal. What they did concentrate on is keeping the food pantries open and delivering some of those goods to other dispensers, as well as the needy in St. Lawrence County. I find out that there's a huge demand for diapers, and because of that, the people that need them, at least the moms, can't get out and do it safely. So some of these folks over there at CDP are actually delivering diapers to those that need them. just to those people, and I think that's quite a feat, to have them accomplish something like that for such a needy group. So they're doing a great job with respect to that. And what they're looking at doing is trying to get through a grant, a vehicle that will allow them to carry a greater number, a greater quantity of the food that they bring out, with the idea of being able to be mobile and go to the outlying areas of St. Lawrence County where the people that are needing these things live and are literally trapped sometimes for lack of a vehicle, lack of somebody with a license to drive a vehicle, and any number of other things. So that is a work in progress, looking for that. I told her that we'd certainly be looking to borrow that once in a while if it were suitable to do mobile testing for this COVID virus. So she's going to keep that in mind when she's looking for a truck. And Head Start is a concern of theirs. Of course, it is in limbo for the summer, but it will be starting up pretty soon, and they're looking for guidance from the state, much like everybody else is looking for guidance from the state, and not getting it in a timely fashion. Although I must say that for the past couple of weeks, the guidance has been forthcoming on a timely basis. So hopefully they will get that. They expect to get back up to full speed, hopefully within the next couple of months, and they're doing well, they're busy, and I'm told that these folks really enjoy doing what they're doing, so I think that makes a big difference too. There's no complaining or moaning about, we've got to do this, we've got to do that. It's something that they really enjoy doing, helping. So I think we've got a great group there, and I applaud them. I think they do a great job. Thank you.
Thank you, Mr. Lightfoot. Community Services Board, Mr. Akers again.
Thank you, Mr. Chair. This Wednesday, we will be meeting to discuss the 3 proposals from St. Joe's, St. Lawrence Health Systems, and actually the county. So that discussion is supposed to take place at 3 o'clock. Looking forward to it.
Thank you. Mr. Denisha, Office for Aging Advisory Board.
Thank you, Mr. Chairman. We haven't had a meeting since my last report, but I do want to put in a plug for the Office for the Aging. It's in regards to the home delivered meals. The home delivered meals have gone up about 40% since the COVID pandemic started. And the Office for the Aging is in need of volunteers. Volunteers to deliver meals, volunteers to help with preparation of meals. There's even a phone service that's set up. Someone would just rather answer the phone or call on some of the folks that are homebound. And as Mr. Lightfoot said, there are you would not have any idea how many folks there are in the county that are dependent upon services like this. And it's largely volunteers that help get it done. So I would encourage anyone, you got some free time, you're looking for something to do, it's a good cause, give Andre a call. She'll push your work.
Thank you, Mr. Jay. Youth Advisory Board, Ms. Terminelli.
Hello, everybody. So our last meeting was on Thursday, June 25th via Zoom, and we had a great turnout because we had not just the members that were invited, but also the youth applicants that you see before you in your packet tonight. They were also on our Zoom meeting just so they had the opportunity to put faces with names and just chat with them a little bit. And I would say that was the bulk of our meeting, was just giving them an opportunity to introduce themselves, and just say why they had filled out the application and wanted to be part of the youth portion of the Youth Advisory Board. Let's see, with YCC funding, the summer programming has been canceled for YCC. There have been a couple of requests to Alexa through the Youth Bureau to support services for things like Indian Creek Nature Center. So looking at how we could collaborate with some of these nonprofit organizations that had relied heavily on the services that the Youth Bureau provided throughout the summer in the past, and seeing how maybe we could collaborate with some other organizations to get them the volunteers and the support that they need. Let's see, and that was, like I said, pretty much it. We got a chance to talk to all of the youth candidates that submitted applications, and then we're going to have that opportunity again informally. I know they're not part of the board yet, but informally on Thursday. They've been invited to join us in another Zoom meeting just so we could look at what the vision for the youth of St. Lawrence County would look like. And these members are from all across the county, so it's very neat. One kid actually skateboarded to Miss Backus's house to drop off an application because he thought he had been overlooked. He wanted to make sure his application got in. So it's just really exciting to have the youth in our community wanting to get involved, wanting to support the county. So it's good news going forward.
Thank you, Mr. Terminelli.
You bet.
Mr. Chairman,
Yes, Ms. Haggard. Yes, go ahead, Ms. Haggard.
could we go back to the Office of the Aging? I wanted to ask Mr. Denisha a question.
Yes, by all means.
Thank you.
Go ahead.
Thank you. Mr. Denisha, you mentioned a name of who should be contacted if people wanted to volunteer to help out, and I didn't quite get that. Could you tell me what that name is?
Absolutely, that would be Andrea Montgomery. And she's the head of the Office for the Aging.
Head of the office. Okay, thank you very much, sir.
Thank you for asking.
Any other questions? Okay, any old business to come before the board? Any new business to come before the board? Services Committee, I mean. And there is a need to go into executive session. We'll do that at the next meeting. And so if there's no further business, we'll adjourn. Meeting adjourned. Does anyone else?
Call the July meeting of services to order, please. Get a motion to approve the agenda. Mr. Akers and Mr. Forsythe. All those in favor?
Aye.
Opposed? Carried. Would I entertain a motion for the approval of the minutes of the June 15th meeting? Mr. Forsythe and Ms. Curran. All those in favor?
Aye.
Opposed? Carried. First on the agenda is a discussion or presentation, if you will, from Sheriff Big Wharf regarding police reform and reinvention collaborative for New York State.
Thank you, Mr. Denisha, and thank you to the board. I'm sure, as a lot of the public is, you're wondering what this police reform is about. So I've developed this PowerPoint, and I'll kind of go slide by slide. And after I'm all done, we'll let you ask some questions. So I'm sure you'll have a few. And then after that, I want to make a statement of what's been going on in our area, the state, and the nation, in reference to law enforcement as a whole. So we'll start out with the police reform. It's a compliance with the Governor's Executive Order 203, New York State Police Reform and Prevention Cooperation. According to our New York State Sheriff's Association, it's a recommendation to the sheriffs that we voluntarily, proactively undertake to go through the process of review, consultation, and plan outlined in the Governor's Executive Order 203, engaging the communities and stakeholders in the process. So there's going to be a lift here, but I'm going to explain that for our county, for my purposes, it's not as big as you probably would think it might be. If not adopted, excuse me, the county could lose all state funding for all the county programs. At first, I thought it was just funds to the sheriff's office or law enforcement as a whole. After reading the executive order, it's all your funds. So obviously, being the sheriff of the county, I don't want to see certain funds not come into the county, millions of dollars. So I'm taking a hard look at this, and for sure we're gonna comply. Go ahead, Dylan. So as sheriff, I will participate in this process, indeed lead the process, and I've already been in contact with all the chiefs in the county, chiefs, SUNY chiefs, some other partners, state police, other agencies, to get the ball rolling with them. So we're all kind of trying to do this in a cooperative, instead of I do my thing and Potsdam PD does their thing. We all want to kind of get on the same page together and go forward with this process. Some, like I said, our department might be a little different than some other departments on how much they have to do to get to the standards. I want to point out that I'm an independent constitutional officer, obviously the only elected law enforcement official in the county, and I have set the policy in my office, nobody else. The sheriff should remain open to ideas, recommendations for improvement, and I do, but I'm not bound to comply with policies attempted to be imposed by other governmental officials. So because I'm the elected sheriff of the county, I'm the one that sets the policy. But I'm glad to work with all agencies, all people to come to some sort of conclusion. Any resolution or local law adopted by the county as part of this process should be couched in terms of recommendations or such, not mandates. So it's kind of important. Even the best agencies can find opportunity for improvement, and we're no different. The Sheriff's Office can show improvement. The process doesn't have to be a negative one. When you take away the verbiage in the executive order, and you know how that can be stripped away, we really don't have that far to go to get this done. There's 4 steps that are required in order to meet the terms of Executive Order 203, and I'll explain each one of them as we go. Number 1, the county must perform a comprehensive review of current Sheriff's Office appointments, strategies, policies, procedures, and practices. This can be done a couple different ways. It can be accomplished by the sheriff providing the county legislator, your board, with reports on sheriff's current deployment, strategies, policies, and procedures and practices. We have a policies and procedures. We have for years. All law enforcement agencies do. The book is about yay thick. It's like the old Sears catalog. The new Sears catalog is like this big now. The old one used, well, that shows you how old I am. Some young people, you know how it is. So the old Sears catalog was the big joke, and ours is probably thicker than that. And we've been using it since I came on in actually 1987, excuse me. I want to say 97, but I'm older than that. So that's one of the requirements that you see our policies and procedures, I don't have an issue with that. It's an open book, it's transparent, it's right there for everybody to look at. So we can get you those policies and you can review those in full by the board. Number 2, the chief executive officer of the county is tasked to call together the sheriff and the stakeholders. I'll tell you who the stakeholders are going to be here in a minute in the next slide. In the community to develop a plan for needed improvements to current employment, strategy, policies, procedures, and practices. Kind of a broad general statement. But this can be done by getting partners together, having roundtables, having multi-group, having meetings, and I'm going to tell you how we've already started that process going forward. The stakeholders, as I mentioned, you can see that this group here, sheriff himself, the members, my undersheriff, we've already got a few people on our committee, community members, emphasize the community with high police interaction. Could be renewal house, could be probation, could be a lot of people. And I've already had literally 2 or 3 people call my office, just the general public, saying I want to be on these committees, which is great. I'll take your input. Come on board. The more the merrier. Interest in nonprofit, faith-based community groups. The district attorney's office has to be involved, the public defender, and local elected officials, mayors, town supervisors, all those can be part of the process. In developing a plan for any needed improvements, and some improvements will be needed, but some we already have the boxes checked, will be considered, are the following. Evidence-based policies, strategies, including use of force policies, and I'm going to talk about use of force policy a little later. Implicit bias awareness training, de-escalation training, I'm going to explain all these later in slides, so I just want to go through them quickly. Model policies and guidelines by DCJS is what all of our policy procedures already are governed by. Standards promulgated by Law Enforcement Agency Accreditation Council, I'm going to talk about us and accreditation, and which most, 2/3 of the sheriffs across the state are already accredited. We're going to talk about that in a few minutes. Number 3, the plan shall be considered through public comment, and after consideration of such comment shall be ratified by resolution or adopted by local law no later than April 1st of next year. So we've got some time here. I don't want to wait until April 1st of next year to get this done, obviously. I've talked to the county administrator. Hopefully we want to get this done by the end of the year, if not January, February. I don't want to wait until the last minute. So it's something that is really not going to be that heavy a lift in certain spots, but it is to do it, your due diligence to make it efficient. You just don't want to do it in a couple months. It's going to be a process. And number 4, the county shall transmit a certification to the director of the budget that the process has been complied with and the resolution or local laws has been adopted. So there's your 4 steps. And I can tell you right now, talking to the sheriffs in the state, which we do weekly, if not daily, the 62 sheriffs get on conference calls all the time about a lot of things, not just police reform. But this is a work in progress, number 1. Number 2, it's fluid. Every day it seems to be, they want this, they want that. So it changes daily, if not weekly. So how the Sheriff's Association, how the sheriffs are going forward, it's a fluid situation. What I say in here today on how we want to handle a meeting might change next week. We want to add something else. So this is kind of moving as we go. Next, Dylan, if you don't have it already. So what we've done so far. So I'll explain what we've done, and then I'm going to explain going forward what we're going to do. Again, I've already met with the chiefs, state police, and the SUNY chiefs, SLU director, all the people in the college forums. We wanted to get together when this first came out. Okay, what's this about? What are we going to do? So roundtable discussion, who we want to talk to, colleges. We're one of it. Obviously, we have 4 big colleges in our county. They're a big part of our county, not all of it, but it is part of it. We want to make sure we have them part of our forum. We trained a lot about we talked about training and education components. Those are big things that are part of the police reform. If you really get into the meat of it, that they're really looking for, which is great. More training, it's more professional, more efficient, education components, all for it. Definitely 100%, not a problem. So after we had that meeting, we met with the college forum group, which consisted of myself, all the chiefs, all the 4 college presidents, the mayors of Potsdam and Canton, and 2 town supervisors of Canton and Potsdam, and some other people that were involved. We discussed a lot of college issues, whether they're coming back in the fall, whether they're not coming back in the fall, what's that gonna look like? If they do come back, are there gonna be protests? How are we gonna handle those protests? Other plans, getting public forums for the college students. If they wanna talk to law enforcement, communication isn't a bad thing. Be involved in some forums. I said, yep, I'll be right there, not a problem. And the chiefs agreed. We'll sit down with the college kids and talk about their issues and getting some feedback. No issues with that at all. So we discussed a lot of that and working with the students when they do come back, if they do come back. So obviously that's a question mark. This past week, we met with some professors at Potsdam State, some law enforcement officials, the SUNY chiefs got involved with that discussion, and we kind of got into more police reform, but then the tangents went into some national and local issues pertaining to police reform. And I'm going to talk about that a little bit later. And we also talked about, again, the training and the educational component is going to be huge in police reform, which isn't a bad thing, training and education. So what we've done for training so far is everybody, the police officer, has to go through the academy, whether it's State Police Academy, some of our local police departments send them through the Canton Academy, and Potsdam has Academy as well. So, and I'm the head of the Canton Academy. We've already got a lot of this training that is required in police reform at the academy. It's already being done. Now, other academies that they do in other parts of the state, I can't speak on that. Maybe they don't, maybe that's why they want this in there. But I can tell you, I instructed the academy, a lot of these things are already being trained at the requirement. So we're already ahead of the game. Bias training, diversity and inclusion training, verbal judo, which I'm going to talk about in a minute, it's de-escalation, mental health, and others. Those are already being trained at our academy and certified. So all those things are being done. It checks a lot of boxes already. In addition to the academy, when law enforcement goes from being a cadet to a police officer, you have annual trainings that are required through DCJS, as I spoke about before. That's the standard you have to be certified through as the Department of Criminal Justice Services. You don't know what that stands for. I know we use a lot of acronyms, so I apologize. But there's annual training that you are required to perform to be certified in law enforcement. One of those being Article 35 use of force. You have to have that training every single year, and we have. I've had it since 1987, once a year. So I've done it 33 times. We have to do that. And it's a growing thing. It's what they taught in Article 35 in 1987 to what they teach today is much different. Tells you a whole lot. The gray hair shows it. So that's already being taught annually. Defensive tactics training, again, that's an annual thing. It has to be done through DCJS. We do it at the Sheriff's Department. All the PDs do the same thing, state police. They all do it. Firearms qualification. We do that once a year. And we really stress the safety of firearms when we have our day of firearms qualifications. So we've already done annual trainings. Again, a lot of, if you look in the executive order, these are the things they require. We've already been doing it. Online trainings, we've already started some. We do online training. We've been doing it for the last 4 or 5 years because, as we know, through Zooming and computers, we've been doing it previous to this. It's just a way to train our men where we don't have to pay overtime or have a lot of people in a room. If we can do it virtually online, some of our training, which we've been doing, that's great, it saves us money. So we've already implemented 2 weeks ago a training for fair and impartial policing. That's already, it's a PowerPoint. You get online, every officer is required to watch that PowerPoint, watch those videos. They have to sign off that they've completed that training. So we have live online training. Again, fair and impartial policing, is in the executive order that we have to have. Checks another box. What we're planning on doing is having some refresher training. Chief Malkin is a big instructor at our academy. He's trained in a lot of these things that going forward we're going to need, bias training. We've already completed that. We've sent all of our officers for a refresher on bias training. So we've already completed some things. Verbal judo, I talked about that earlier. Verbal judo is, it's been around for about 4 or 5 years. It's a way of de-escalation. It's a way of calming the situation down verbally. So you learn those skills and how to verbally talk to people, whether it's mental illness, someone that's on drugs, someone that's out of control for whatever reason. This verbal judo course, which I am actually a certified instructor, I had to go down to Syracuse for a week and learn how to teach verbal judo. It's a pretty good program. And what it really does is it teaches you verbally how to de-escalate situations. And that's taught at the academy, and we're gonna have a refresher on that. As a matter of fact, Chief Murray is doing some refresher. I just talked to him today. Wednesday, he's got some officers from our department, his department, some other departments that are gonna go in. He's gonna get a refresher on verbal judo, because everybody gets it in the academy. I teach that also. I don't have the time to do it. He does, so he's gonna do it for us. But I can, in a pinch, do verbal judo training. So it's a very good course. Not just police officers use it, believe it or not. Teachers have been taught verbal judo, dealing with kids, situations where they get out of hand. So it's just not police officers that handle actually verbal judo, it's other professions. Accreditation, I talked about accreditation. This is gonna be really important for us going forward. This really checks a big box for police reform. 2/3 of the sheriffs in the state have accreditation. We once had accreditation. What happened was the accreditation officer, and it's a pretty timely mandate that has to be completed, so it takes a lot of man hours. The officer that was our accreditation manager retired. And it kind of fell by the wayside, and you have to keep up standards year by year. If you don't keep up with those standards, they take away your accreditation. So 4 or 5 years ago, we didn't keep up with the standards, we didn't have the manpower to do it, it went by the wayside. So when I got to be undersheriff maybe 2.5 years ago, the sheriff at the time, Sheriff Walls, and I sat down and said, listen, we need to be accredited, it's important, standards are high, we want to have the highest standards, just like all the rest of the state does. So about 1.5 years ago, he said, well, undersheriff, it's your baby, go ahead with it. And so I was tasked to get our agency accredited. It takes a year, 1.5 years of going through the process, of going through all your policies and procedures. Again, the Sears book is this big, one by one, making sure you're accredited. And if it wasn't for COVID, they were going to come and review us in May with the process to be approved. COVID came, they said we can't do it right now. Luckily, they did call back just 2 or 3 weeks ago and said we will be there July 27th. So they're coming, the State Accreditation Council is coming to our office July 27th, and they go through everything. Literally, they walk through your cars, they look through your evidence, they go through all your offices, they will pull an officer out of a car and ask him questions, they'll pull the undersheriff over here, ask him questions, they'll go up and talk to our chief fiscal officer and ask her questions. It's quite the process to be accredited, and rightfully so, because you want that standard to be high. And I don't mind having that standard high, because it checks a lot of boxes. When you have that high standard, you're doing a lot of things right. You go, not only do you meet a lot of the police reform standards, you go above those standards. So that's a great thing. So July 27th, when they walk in, we're gonna work hard to make sure we get accredited, and hopefully it takes a process after they review you to get a couple months to approve or disapprove. They give you a chance to, okay, this is what you need to work on, get us this, and within a month, we'll look at it, and you check another box. So accreditation is really, really important, and I don't know why, but Nostradamus in me a couple of years ago said, Sheriff, we need this. So I was kind of ahead of the curve, not knowing that we'd ever be facing police reform. So I'm very confident that being accredited, and I'm confident we're going to get this approved, that'll really check a lot of these boxes in police reform. So happy to do it. If you have, go ahead, Bill, next one. Police cams, this has come up to me. This is part of the police reform, part of it. I can tell you the New York State Police is going to be mandated by next year to have all uniformed troopers have body cams. And if you look at the cost there, I don't know if you can see that little print, that's why I'll bring it out to you. The cost just for the first year implementation is $31 million for the state. Quite the cost. But that is mandated, that's mandatory. Our office is not mandatory. Now, whether we have it or not, I don't have a problem with it, but obviously it comes down to a cost. So I've been doing, my undersheriff and my fiscal officer, confidential secretary have all made a committee, and we've gone through some cost analysis of body cams for our office. And you're talking from $44,000 to $70,000. That is just your first year implementation. That's not every year after your maintenance costs, your warranties, your software, your server that you have to handle. So there is, through the, whether it gets passed or not, I know the federal government's coming up with some police reform. There's some bills out there going back from House to Senate. You can, go talk about that all day. But there was part of the bill that the federal government, if you went to body cams, and one of the things I read was a matching grant, which you're gonna come up with half of it. That's what the federal was trying to get in one of the bills. Whether that happens or not, I don't know. Whether the state comes with some money to get these, I don't know. Again, it's a fluid situation. I can't tell you if it is or isn't, but I have had some questions on body cams. Would you wear them? But it always, a lot of times comes down, especially to you guys, cost. And it's not cheap. But it does good things. It covers you, and I don't have any problem with having it in our department, but it comes with a cost. And it's a pretty good price tag in my opinion. But we're trying to work with 4 different vendors to see if we can get the cost down and exactly what we need for footprint, and it's a work in progress. And I'll keep you informed on that if anybody wants to know. So what is planned? So more public groups, forum meetings. Obviously, we have to continue the process. More meetings with the college forums, and we have some already set for this week and the following weeks. We have to go through our policies and procedures, although again, because of the accreditation, we've already been doing that one by one. So that's not going to be a really heavy lift. But we want to make sure we review our use of force policies. And if you didn't know, and if you do have our Sheriff app, and I hope you do, if you don't, you should probably try to get it on your phone. It is a free app. Our use of force policy is on the app. You can go to a tab, toggle down use of force, and you can, and the public can see our whole use of force policy. It's out there. It's transparent. It's been out there since we went on live in February with our app. Go ahead and look at it. It's there. But we're going to look at that just to sharpen it up. Again, for the state accreditation, I think we're in good shape. And then I have to meet with the chief executive officer, plan for more reviews and more police. Again, this is fluid. Every week we get something new, we get something different. This is how we want to go forward with this. So we really want to give it a month or two to see where we're at with it totally. And then we'll start the forums and the bigger meetings to make sure we meet all these benchmarks. So with that, I'm going to read a statement after this, but I'd rather parse it where you can ask questions about police reform, and then I'll go to my statement. So does anybody have any questions?
Mr. Smithers.
Could you expand a little on what you said there briefly, meeting with college forums? Like each college?
No.
Specifically, how many or?
Right, all.
Or what that's going to be?
Yeah, so it's all 4. So we want to do it together. We started out with a couple colleges, and on our first meeting, we're like, well, this really doesn't make a lot of sense. Let's get all 4 together. Let's not go one meeting here, one meeting here, one meeting here. So we got together. It started out with just a couple colleges, and then moved over to Potsdam. So we didn't want to do one here, and then I'd have to move over there, or our group over there. So we said, listen, this is not really efficient. Let's get all the colleges together. Let's get all the chiefs together. Let's get all the college presidents together. Get their people they want on the meetings. Get the town supervisors involved, the mayors of the villages involved. Let's all do this one time. Let's not go to 15 different meetings. It just made so much more sense to bring this whole big group together and talk about police reform as in a whole, instead of doing this meeting here with this group. Just efficiency and how it would work just didn't work. So it's kind of evolved where all the presidents are on this Zoom meeting, all their people they want involved in it. Again, the St. Lawrence University security director, the Clarkson security director, the 2 SUNY chiefs are all there. We're all one big group talking about how the colleges are going forward. So that's a good question, because we started out small and said efficiency wasn't really smart. Let's do everybody at once.
Mr. Akers.
Sheriff, can you describe your position on the chokeholds that seems to be
Yeah,
right
so,
now? So it's not
that's obviously something that we don't do with the sheriff's office, never have. It used to be years ago, they didn't call it a chokehold, but a sleeper hold, where they did that, but we don't teach that in our forum. We don't have that, so that's not in our use of force policies, like the use of the chokehold. Obviously, I'm against it. So yeah, it's not something we teach. It's not something before, and it's not in our use of force policy. Thank you. Great question.
Ms. Haggard.
Sheriff Big Wharf, I downloaded the app while you were talking. It's really cool. I like it. I had no idea there was an app for the St. Lawrence County Sheriff's Department. My question is about the diversity and inclusion training that you pointed out. I'm not sure how we would do this, but are the diversity and inclusion trainers part of groups that might be considered minorities or persons of color, or is it usually taught by people who are from the academy? Is there an effort made to bring in people that are from diverse groups?
Sure. So our instructor right now, Chief Malkin, is to teach certain aspects, whether it be at the academy or through your annual training. You have to be certified through DCJS. You have to go through a rigorous amount of training. I'll talk about training when I speak down the road here. But you just can't have anybody teach these topics. It has to be certified through DCJS, that they're a certified instructor, and sometimes it's specific to that topic. Like a judo, verbal judo instructor that I'm trained in, not everybody can do that. You have to be specific to that training. So Chief Malkin does a great job. He is our certified person for the topic they're talking about. Can their college professors teach certain things? They can at maybe a forum, but they can't to law enforcement because they're not certified through DCJS. Does that make sense to you? I wish they could, but the Department of Justice Services is not going to have them, because they're not certified in instruction to law enforcement, they're not going to allow that to occur.
But there is a dialogue between people through the colleges that might have a different viewpoint than most of us up here.
Right, and that's what
diversity.
Yeah, I'm sorry about, but that's what the forums are for. That's where they can interject and speak about, that's where the forums are coming, which is great. Again, we've already had a couple forums. We had a forum with Boston State professors, and they did acknowledge some of these things you're talking about and give us their perspective, which is fine. I'll take these perspectives, I'll take their opinions. Everybody should have some input. I have no issue with that. And we've had some vivid discussions so far on some topics. I can say that. And we will continue to have more discussions. And I think discussions brings about change. It's constructive change. And again, I'm not, as I said in the beginning, I'm not unwilling to have some opinions and discussion and some change, for constructive change for the right reasons.
Thank you very much.
You're welcome.
Does anyone else have any questions for Sheriff Big Wharf?
Okay, so as sheriff of the county, I know I've got a lot of phone calls and a lot of people kind of asking about my stance and law enforcement as a whole, because nationally a lot of things have been happening, and even locally things have been happening. And I just want to read this statement. Last couple of days I kind of wrote this up, and you can ask questions about it after or make comments. I'm going to start with a quote I saw the other day. The ultimate measure of a man is not where he stands in the moment of comfort or convenience, or where he stands at the time of challenge and controversy. As professional law enforcement officers who have dedicated their careers to saving lives and helping people in need, the sheriffs of New York State condemn the senseless, shocking action of the officer who justifiably took the life of George Floyd in Minneapolis. It was against everything we stand for, everything we are trained for, and everything we demand and rightfully expect from our police officers. We are sworn to uphold the Constitution, and we fully support the constitutional rights of all citizens to peacefully assemble, protest, and petition their governments for desired change. As constitutional officers who have been given the duty of the conservatory of the peace in the county, we know that conserving the peace does not mean just keeping everyone calm. It means assuring an atmosphere where all citizens can enjoy the rights to life, liberty, and the pursuit of happiness without those rights unduly infringed upon by others. Deputy sheriffs and all law enforcement officers suffer because irresponsible leaders paint them with a broad brush. There are 800,000 police officers in this country. The unexcusable actions of few police officers cannot be used to justify labeling all 800,000 of those officers that are dedicated, hardworking police officers as racist. We don't know of no police officers who condone the actions of those few officers. They, like most citizens, were sickened to see that video. We also know that there is not representative of the 53.5 million contacts law enforcement has with civilians annually. We know of no police officer who joined the force because they saw a license to kill or abuse others. Most police officers join out of a simple desire to help people of any race. Over the past 3 decades in my 32 years in law enforcement, I've seen up close the dedication of law enforcement officers who protect the citizens of St. Lawrence County. I have the greatest respect for their sacrifices and service. I've been a deputy, canine officer, dare officer, juvenile officer, major crimes investigator, detective sergeant, undersheriff, and now sheriff. I've instructed at the academy. I'm a certified general topless instructor, ethics instructor, verbal judo instructor, and master instructor. I've been involved in almost all aspects of law enforcement. I don't tell you what I've done this past 33 years to be boisterous, but I only have to say I've seen a few things over these years. There are dangerous, evil people in this world. I wish there weren't. When that dangerous, evil person comes to your front door, forces entry into your house with your children there, who will you call? You are going to call that person who's sworn to uphold the law wearing a badge. They are not going to be cowardice. They are not going to turn away. They will come into your house and protect your life, no matter the consequences, no matter if they never go home. Who is going to investigate child sex crimes, internet crimes, elderly abuse, drug crimes, and drug dealers to stop them from hurting your children, parents, and grandchildren? In the academy, a great deal of time is spent learning about the laws. Departments do additional training, and all of this education is used to protect you and your loved ones. They learn about the Constitution, how to de-escalate, crisis intervention, dealing with mental health in their crisis, and many, many other issues. Do you think it's exciting for a police officer to go to work? Who would want to be a police officer now? These are good people who are trained and are educated. Policing is not just a job, it's a calling. People will answer the call on a daily basis. A well-funded police department with good, adequate training, that's what's going to keep the people safe. The noble police officers that go out to serve and protect on a day-to-day basis, they deserve support. There are bad apples in every profession. The police department is not exempt. Every person I spoke with hates bad cops. Good cops, the good ones who stick around, who do the job properly, also hate bad cops. I was raised by parents who taught me to love and respect people regardless of their race or background. We need to let police officers put their lives on the line every day to protect us, are all respected and supported. Each year, there's a ceremony held at the Police Memorial Wall in Albany where names of New York's 1,622 hero police officers killed in the line of duty are described. There's a long tradition spanning several decades recognizing officers' sacrifices above and beyond the call of duty. No one should forget any of those officers' sacrifices. The time has come to hear each other, to support each other, to work collaboratively to bring clear, transparent, and fact-based information, ideas, and reform forward through peaceful dialogue and education. Let us work together to effect the positive and constructive change that we all wish to see. Let's do so in a way that accomplishes our goals without endangering the police officers who already risk so much or the communities that they serve. I have always and will continue to support the brothers and sisters in law enforcement. And I will ask that you respect and support them as well. I will end where I started. The quote, "The ultimate measure of a man is not where he stands in moments of comfort and convenience, but where he stands in time of challenge and controversy." And if you're wondering who said that, it was none other than Martin Luther King Jr., a great man in his own right. Thank you.
Very good, Sheriff. Does anyone have any comments or further questions for the Sheriff? Mr. Smithers.
I'd just like to thank you for that.
Thank you.
Thank you.
That's what I was gonna say too. Thank you for all you do. I know that right now is probably the hardest point, you know, because you have to listen to all the bad when we know that you've worked so hard for so long, and we appreciate it. I appreciate it very much. Thank you.
Well, it's not about me, it's about the officers and law enforcement.
All
It's
your
not about-
officers work very hard too.
Very good. Thank you, Sheriff. Thank you for all you do. Okay, next on the agenda is Jason Fotenhauer, Planning. Jason, there you are. We have a resolution authorizing the chair to sign a contract with North Country Housing Council for the delivery of countywide housing rehabilitation program round 3. Could I get someone to move this resolution? Mr. Lightfoot and Ms. Curran. Go ahead, Jason.
Thank you. Good evening, all. This resolution is to address, as you said, the third round of our countywide housing rehabilitation program. We are looking to work with our longtime partners, the North Country Housing Council, on the delivery of this round of this project. We have worked with the Housing Council on the previous 2 rounds. The first round 1 finished up in 2018, round 2 finished up in 2019, and looking to continue with this third round that is slated to be finished in 2022.
Any questions on this resolution? There being none, all those in favor?
Aye.
Opposed? Carried. The next resolution reauthorizes the North Country Home Consortium with the counties of Jefferson and Lewis for the purpose of obtaining home investment partnership program funds from the U.S. Department of Housing and Urban Development. Mr. Forsythe and Ms. Terminelli. Go ahead, Jason.
Thank you. Yes, this is something that may be new to some members of the board. The North Country Home Consortium is a partnership that has existed since 1993. At that time, it was put together by Jefferson, Lewis, and St. Lawrence County, and it was done with the intent of securing funds, a special allotment of monies that were available through housing, that Department of Housing and Urban Development at that time. It's continued to this day, and we've been very successful over the years, dating back to 1994. Through the Home Consortium, we've been able to secure $13.3 million for housing repair, first-time homebuyer repair, and rental housing repair in St. Lawrence County. A project that's most recently been funded here is a redevelopment of some housing, some rental housing up in Roosevelt Town that the Home Consortium has funded the Mohawk Indian Housing Agency for the development of that housing. So it's a great program. It is renewed every 3 years, and we're just looking to formalize the continuation of this program.
Does anyone have any questions on this resolution? There being none, all those in favor?
Aye.
Opposed? Carried. Next up is a discussion on or an update on the lead grant. Jason.
Yes, thank you. I was last before you to talk about the lead grant on June 15th, a month ago at operations in June, and at that time, Mr. Denisha asked if I would come back this month and give you an update, talk about a little bit about the progress that we've been making. And I can say that we have made some progress. We have been working on our outreach program. We did have a radio interview about the program that aired on the 2nd of July. That resulted in a number of emails and inquiries about the program to our office and our subrecipient, the North Country Housing Council. We've also spoken with the press on several occasions, again, getting the word out about the program. We've met several times with our partners on this program, again, the North Country Housing Council and the county's Public Health Department, just to make sure, again, that we're doing everything we can to move the needle forward on this. We've been in contact with our HUD representative, just to give them, again, a sense of where we are with the COVID restart and how we're moving forward. I won't say post-COVID, but now that we're in a position where we have staff back at the North Country Housing Council. They were furloughed. They are now back and working hard to again move this program forward. We have made contact with all the interested individuals that are on our waiting list. We have, again, since our last meeting, we have completed one lead risk assessment. We have signed a contract to start work on one home. We have another bid that is slightly over the HUD standard cap of $20,000. So what that means is we just need to have a discussion with HUD, and that is occurring right now to ensure that we will be able to move forward with that unit, to repair that unit, just getting the special dispensation from HUD to go over that 20K. We have also distributed 4 additional applications to interested and eligible households that have requested such. So again, we continue to meet weekly with our partners, and just want to make sure that everybody is on the same page and we are making some progress. One thing I will mention is that the benchmarks that I did share with you back in June have all been put on hold by HUD. So we are technically, we're not out of compliance right now, but that is because the benchmarks have been suspended. We obviously still have some room to go. We have funds that need to be distributed, but we are not currently out of compliance with HUD. So happy to answer any questions that anyone may have on the lead program.
Does anyone have any questions for Jason? Mr. Akers.
Thank you. Jason, are you still limited to the 3 contractors that are certified? Is that all we have still?
Yes, Kevin, unfortunately, we only have at present 3 certified contractors. We're always looking for more, though. If they're willing to go through the process to get certified with HUD, then yeah, we'd absolutely take additional contractors.
The process is quite rigorous, a lot of paperwork and compliance, so that's probably a attraction for some of these guys or gals to actually do the work.
Correct. There's a 5-day course requirement, and then additional fees that are necessary to be maintained by the contractor. We can pay for and have done so, paid for the 5-day course, the fee for the 5-day course for the 3 contractors that we do have, and would look to do that for additional contractors if they were interested.
Yeah, I think the limit of 20,000 would be limiting the number of contractors that you would have too. You can't make much money on something like that. And really, it doesn't take, you throw in a kitchen, it's going to cost you 10,000, 15,000, you know. So that's probably if you could get that HUD to raise that limit to 40 or 50, you've got a lot of money to spend. And if you only have the 3 contractors and a $20,000 limit, you're not going to be able to spend very much money.
Agreed. Yeah, absolutely. And what we'd like to do, and what we are planning on doing, is pairing up the resolution that the first resolution we spoke to tonight with regard to the CHIRP 3 funds. If we can pair up some rehab on a unit with lead money, then that is certainly more appealing for a contractor, because they can be paid for rehab of the house out of one program and the lead abatement work out of the lead program. And then you're absolutely right, it makes it more of an appealing job.
Thank you, Jason, and thank you, Chair Denisha.
Thank you.
Any other questions for Jason? There being none, thank you, Jason. And we'll move on to the 2020 census update. Jason, are you going to do that, or is John?
No, I'll be doing that tonight, Larry. Yep.
Okay, thank you.
Sure. Thank you. So yes, the numbers you were shared, or the numbers were shared with you over the weekend. The latest response rate numbers for New York State, the United States, and all the towns in St. Lawrence County, and things are ticking up slowly. We've gone from 52.5 as of June 26th, 52.5% response rate in St. Lawrence County, to 52.9% on July 10th. So, you know, almost a half a percentage point, not a huge jump, but it's progress in a pretty short amount of time. We have been really pushing out a lot of literature and other promotional material for the census. Over 10,000 pieces of literature or other items. You may have seen census fans or census water bottles. Or I'll move out of the way here. I think you can see that census banner that is, I just put it, it's what we have in our office. I just put it so you can see it here. There's also one outside the Board of Legislative Chambers, and one in the outside the courts and the courtroom area of the county complex, as well as at other municipalities. We've distributed those to town halls around the county. Again, it's all about name recognition, identifying that the census is happening right now, and getting people to fill out those forms. There is an extension that has been offered as well. Initially, the census was going to wrap up the middle of August. That has been extended now through the end of October. So something called a non-response follow-up will be starting up, I believe it's the end of July, and continuing through the end of October. And that's where the enumerators actually come out to individuals' homes and say, hey, you haven't completed the census, you have 10 minutes, let's do it right now. So that will start at the end of this month into August and go through the end of October. And with that, we really hope that we'll see a jump in responses to get more people to participate. We've had some other ideas about how to get the word out. One that's come up is working out an arrangement with schools, fire departments, any entity that has an electronic reader board that's out there. If you've driven down to Watertown lately and past Indian River High School, they have a large reader board outside their school. And I was driving by a couple weeks ago, and I guess last week, and saw a reference to the census. You know, if we're undercounted, we're underfunded, I think was the phrase that was up there, that flashed up there quickly. Very succinct sentiment, got the word out about it in just a couple phrases. So we're looking to push that information out to reader boards around the county as well. And I mentioned the material. Yeah, just back up just a little bit. The materials that we have pushed out. We've partnered with Community Development Program, the League of Women Voters, and municipalities to get that information out. So at the Cooperative Extension food distribution event that happened a couple weeks ago, there was a flyer that went out about the census. School lunch distribution programs all have had census material distributed as well. So we're trying to do as much as we can, getting the information out as quickly as we can and as thoroughly as we can. And I will, if it's okay with the chair, look to see if Mr. Burke, as the chair of the county's Complete Count Committee, has anything further that he would like to add, if that's all right.
Absolutely. Go ahead, John, if you'd like.
Well, you've covered all the salient points, and I guess the the question that I had, and that I had asked John earlier in the week, was about when the census workers are actually going to start, and he had indicated that there was some movement in the hiring of individuals. That's certainly, I mean, when we have low response rates, that seems to be the key focus of people going to their door, leaving brochures on it, or I don't know whether they're going to knock on people's doors and look for a response. I don't know what limitations they're going to have, but but I think it's certainly a concern, the low rates in some of our communities, and I don't know whether you mentioned it or not. I know you talked about the electronic boards, but there was a recommendation from Marty Miller to use the highways electronic board and rotate it from town to town, especially in the areas where there's low response rates, which, you know, I thought was a really great idea. I think, Jason, you and John are doing a great job. We're a little bit limited by this COVID virus, but again, I think we're doing everything we can do.
Thank you.
Thank you, John. Anything else, Jason?
That's all I have, Larry, unless there are questions.
Mr. Forsythe.
Yeah, thanks, Jason. How receptive or what responses have been from the Amish community today? Any idea?
We don't have that specific of response data back, David. It's certainly been received. We've had outreach to various bishops in the Amish community to get them on board. We did a lot of outreach 10 years ago and really made some inroads with through an individual that was well connected with the Amish. That individual is no longer working in that same capacity, so we've lost that connection. But we have we've done distribution of material, census material, on all county buses, and the Amish are very our best riders, if you will, on the buses. So we know that they're getting the word that way. In terms of an actual number of what their response is, I do not have any way of knowing, how many Amish have responded, but we're certainly reaching out to them.
Yeah, I think once people start going door to door, that'll be where you get the most of them. Okay, thank you.
You're welcome.
Any other questions for Jason? Thank you, Jason.
Thank you very much. Have a good night.
Okay, Ruth.
So you heard the summary for the operation or the services meeting. I apologize. So we can move right into the department requests. The first one is from the sheriff. He is here.
Thank you. So the first one is a sergeant's promotion, actually. Sergeant Doolin retired recently. I'd like to acknowledge him. He's 30 plus years on the force. Did a great job, but he's left. So we lost the sergeant position. A little background on the sergeant positions. At one time, years ago, we had 9 sergeants in our department. One being a juvenile sergeant, and several detective sergeants, and 4 road sergeants. Years ago, we lost the juvenile sergeant through attrition. So we went down to 8. And then when I was promoted from detective sergeant to undersheriff, and another sergeant retired, we revamped the major crimes unit, investigative unit, and we went from 3 detective sergeants down to 1. So we lost, not lost positions, but we lost 2 sergeant positions. So right now we currently have 5 total sergeants in the department, 1 being a detective sergeant that supervises the drug task force and the major crimes unit of our department. The other 4 sergeants handle 4 shifts. We have 4 separate platoons. We have 12-hour shifts. So without the total of 4, we would have a platoon shift without a supervisor on that shift. And that obviously would create many, many problems for supervision, lack of supervision, lawsuits because there's no supervision, all those things with our new reforms, bail reform, discovery, use of force I talked about. It's very important to have a supervisor there for each shift. So that's what I'm asking is the promotion of this sergeant. Obviously there'd be cost savings because the sergeant left, he's been there for 30+ years. And whoever the sergeant that for replacement be, he would have obviously that many years on. So there would be a little cost savings as far as his pay. The last part is if there isn't a sergeant on, per contract, there would be an officer in charge and they get an extra stipend for being officer in charge. So there's a cost without having that sergeant on that shift. So many, many reasons why we need this sergeant position filled, and the utmost is the supervision part.
Any questions for the sheriff in regards to this position? Mr. Akers.
So Sheriff, previously I asked Rick Doyle about, the 90 days and the 60. So your 60 days has already gone by, so you'll be looking to fill this immediately?
He left 2 weeks ago, roughly.
So it'll be 60 days?
Well, I'd like this one immediate because I've got a platoon right now without a supervisor on.
Okay, and that's the recommendation for the vacancy?
I'd strongly recommend that lack of supervision could be some issues.
Good.
Obviously, with the importance of our job, supervision's paramount.
Any other questions for the sheriff in regards to this position?
Yep, the second one is actually on the promotion of the sergeant, be an open spot. That's what this deputy position is. Obviously, the citizen safety is paramount. We need all the officers we get. I think the COVID-19 pandemic has proven that our officers are working really hard, handling a lot of complaints. I can tell you 2 places where we've seen a big uptick in complaints. One is domestic violence, we've had an uptick in that, and we've had some mental health issues. If you think about the COVID crisis, being at home, being cooped up, some of the things that people couldn't do before, those 2 things were probably something that would have an increase on, and we have had an increase. So it's really important to have our officers out there protecting the public for a lot of reasons, but the escalation of these 2 areas is pretty important.
Any questions?
Oh, one last thing, I do have 2 or 3 officers actually that want to laterally transfer to this position. Lateral transfer is some officers are coming from other departments that want to come to our department. What that does is it saves us a lot of money on academy costs. So instead of sending a new recruit to the academy for 20 weeks, paying that officer for 20 weeks, and then FTO training after that to get trained, you're talking about a half a year of salary and academy costs. If you get a transfer to come in and take the position, I have 3 people actually in the last couple weeks pounding on my door to transfer to our department. I'll take that as a positive that we run a pretty good department, but there's a couple that want to come back to the area. One is a park police officer that wants to come back from Hewelton. He'd be a great candidate to be a deputy. I've also got another gentleman from the New York City area that's a homicide detective and a sergeant down there that wants to transfer up here. That'd be a great benefit for our department to have all that experience come here. And a couple others have inquired. So I have utmost confidence that we would never have to send anybody to academy if this position is filled. We could get a transfer. So that would definitely help on the bottom line for money.
Good. Make sure they self-quarantine.
And they come from they will self-quarantine.
Anyone have any questions for the sheriff? Thanks.
I think you've seen enough of me tonight. Thank you.
Thanks, Brett.
And next up, we have the DA. Dylan just went to check with them. So if we can skip that just for a moment and move on to the dispatcher. I'm not sure if Matt is there.
Matt, are you in the house? Yes, he is.
There we go. Hi, Matt.
Matt, would you like to talk to us about the dispatcher position in emergency services.
Absolutely. Thank you, everybody. Hope everybody's having a good evening. This position, we filled a senior dispatcher position, and by doing that, it created one of our full-time slots vacant. So what I'm looking to do is move within one of our part-time dispatchers up to full-time status, and then eventually replace that part-time position.
Any questions for Matt? Mr. Forsythe?
Matt, how's the call volume the last 3 months? Well, it'd be hard for you to judge again, but is it up, down, average?
It's gone up. Kind of like what the sheriff said on certain calls, we've seen a sky rise on. And even lately with a lot of the on-control outside fires, we've had a raise on. But yeah, your domestics and stuff like that have gone up.
Okay.
Anyone else have a question for Matt? Very good. Thank you, Matt.
Thank you, everybody.
Thank you. I believe that Gary will be joining us, but he's not on just yet. We can have Tim. Tim is with us. There he is.
Tim.
Hi, everybody.
Good evening. Do you want to talk to us about the keyboard specialist position?
I do. So I've had this keyboard specialist position vacant for about almost the 90 days already. The reason was with COVID had just started and my secretary had retired. So we knew we were going to have a downgrade of paperwork coming in. So I did leave it empty for a while. Now we're getting to the point where the courts are opening back up. County court, family court are already open. The local courts will be opening in a little over a month. And at that point, I think we're going to get a landslide of paperwork coming back from the courts that we've been sending all along for the last 2 or 3 months. So this is pretty much my greeter position. Her desk is at the waiting room window, and she's right at the front door of our office entry. So very busy position. She does all of our mail, does a lot of typing, answers all the phone calls. So I will be looking at filling it, but I'm still going to wait a couple more weeks until we actually hit the 90 days. I'm a couple weeks shy of that 90 days. But I'd like to get her up and trained before the onslaught of paperwork. And I have my senior secretary is going to be retiring within a year, so I definitely want this person trained on stuff that the senior actually does. So when she leaves, she can kind of move into that job space.
Okay. Anyone have any questions for Tim in regards to this position? Thank you, Tim.
Thank you.
Thank you.
And I saw Gary on there.
Right on. There he is.
Good evening. Sorry about that.
Good evening. Would you like to talk to us about your request for the chief confidential investigator?
Sure. Our confidential investigator, it's an integral part of the office, does things for us that, quite frankly, law enforcement in some cases doesn't have the time to do or can't do. They manage all of our, this person manages all of our grand jury subpoenas. There's a liaison with law enforcement for that. In addition to transporting witnesses potentially to and from court, to and from our grand jury, as well as serving subpoenas. And really the most critical role is probably being the lead investigator on various investigations that are either started by law enforcement, where he works in conjunction with that, or by leading our own independent investigations. A good example of that would be, as you all know, we're investigating a death in Gouverneur at this time. 2 days into that, which was led by the state police, all of the investigators working on that by the state police, except for maybe 1 or 2, got called to Malone because there was a shooting there. So that's a case where our investigator can step up and take on part of that responsibility. So it is an integral part of our office.
Does anyone have any questions for District Attorney Pasqua? I think you've explained, Legislator Haggard.
Good evening, Mr. Pasqua.
Good evening.
Is this because of a retirement?
That's correct. Dan Manor, who has been in law enforcement probably for since 1980 here in St. Lawrence County, he is retiring on July 31st.
Best of luck to Dan Manor. Thank you.
Any other questions? Gary, I think you've made your case well. Thank you.
Thank you, and I apologize for being late. I got wrapped up in some other work, so my apologies.
No worries, Gary. Thank you.
Thanks.
And Ruth, you're up.
So 9 of the 11 vacancies were presented tonight, and there are 2 left for finance, 1 for real property and 1 for highway. Next up, I'm excited to announce that last Wednesday, July 8th, we launched the new St. Lawrence County website. And I appreciate those of you who have shared your comments or thoughts on, on what you think about it. I'm going to turn it over now in a moment to Governmental Services Director Mike Cunningham and Assistant Administrator Dylan Soper to give you a test drive of the new site. In August of 2019, you approved $35,000 for a new website. To date, with the website launch, we have spent $29,807.60. That's $5,192.40 under budget. In a separate line for maintenance support, that will be prorated for this year because we're launching in July, $5,950 for maintenance and support going forward. Michael and Dylan?
Yep. Thank you, Ruth. As Ruth said, we're pleased to report that we launched the redesigned website, stlawco.org, on July 8th. And this was the result of a lot of hard work done by our departments, the Board of Legislators Office, and the IT department. Our goal was to have a website that was secure, easy to navigate, and be able to handle future enhancements to the online services we provide the residents of the county. It is important that our residents can find the information they need as easily as possible. And to meet this requirement, our redesigned website utilizes such things as drop-down and classical expandable menus to organize information so residents can easily find the information they're looking for. And some of this information we've already have available on the website are things like the COVID-19 response, agendas and minutes for county meetings, event calendars, upcoming election information, and also the ability to post alerts for our residents when needed. Also, we provide information regarding the services our departments provide, along with the contact information. So if the residents have questions or concerns regarding county services, they know who to contact. Links are also included for our partner agencies, so visitors to the site will have that information also available easily. And at this point, Dylan's going to kind of take you through and show you some of the newer features of the redesigned website. Dylan?
Yeah, so you've seen many of the pictures that we've been scrolling through on the homepage here that were submitted to citizens in the county, and we worked with the chamber, allowed us to have some pictures that they had as well, that I think represent some of the greater landscapes of the county. As Mike said, we did make it our goal to make the website easier to access and more intuitive and more pleasing, visually pleasing. I think we succeeded. We have drop-down menus where people can look for their top online services. I think you can get to the information you're looking for in fewer clicks and more easily, and save a lot of time with the new website. Going down, one of our most popular features lately of the old website was the COVID daily updates. You'll notice there's only one update here. It is the main summary that we had designed with our new website colors. But if you go ahead and either click on this link here or even the picture itself, It'll take you to the COVID Daily Update Center, where you'll find all of the maps and information graphics that we had previously right on the webpage. And it goes down the cases by county, testing, graphs, reopening information, and a link to public health information as well. Going down further, each department has their own county or their own news section, and has the opportunity to push forward county news that will then go onto the main homepage. Some of our bigger issues, as you can see here, we have the burn ban up and the videos that the employees shared as well. If you are looking to see some of the upcoming meetings, we have blocks down here, events. If you were to click on, if you're looking for an upcoming agenda, you can click on this link here, and it'll bring you to links to both of the agendas. This is for tonight's meeting. Up top, you'll see a couple different alerts. We can push these alerts to the top, and these will show on every single page on the county website now. You'll see where our burn ban has been extended, as well as a upfront link to the live YouTube videos that we're doing now. It's much easier for people to access, and hoping that we'll receive more views because of it. Just show you the legislator page that we have. Under Meet Your Government, you go to Find My Legislator. We have the most recent picture of the Board of Legislators here, as well as a map, an interactive map showing the districts, in which if you hover over, we get a picture of the legislator and the townships that they serve, as well as a link to the contact information. If you were to scroll down, we have some more information here, and each of you have your own contact card. For example, if someone is looking to contact you, they can go here, click on your name, and it'll take you to your contact page and an email contact form. Each of the departments has one of these new contact forms as well, and we've already seen, at least in our department, quite an uptick in citizen comments and questions through the contact form. Last thing I'm going to show is on the home page, we've had the opportunity for citizens to sign up for an email alert system. This, once signed up, we're working on getting some more department alert newsletters out there. But once signed up, you can sign up to receive news related to the Board of Legislators, the Sheriff's Department, Public Health, and then each time that there is a news item that goes up that it gets pushed out to the email subscribers, you'll get that right in your email box. And lastly, actually that's all I have, unless there's any questions.
And so next up, with continuing to build upon the new website, we're looking to create an intranet for employees. That would be a direct line of communication between departments, between myself and department level staff, so that they can access information, countywide forms, all kinds of internal documents that you would have access to as well. So a few other things to update you on. As Dylan mentioned, we have extended the burn ban for another 5 days. This is the third extension under the state of emergency that was declared June 27th through July 26th. So each time we near the end of the burn ban, we speak to our emergency services director, and he polls the fire coordinators as well as the fire advisory board to get information and input whether or not we should extend. Next item I wanted to update you on is the enforcement component of COVID-19. There have been changes associated with the compliance. One of the things that we've been talking about in the work groups and the reopening task force are the challenges that we face with enforcement. As of today, and I've just seen a few come in during the meeting, there are 367 complaints submitted for the New York on pause, with just 10 of those today. New guidelines were issued last week,
And if you don't mind, I'll have Steve Button, our county attorney, speak to those changes. Steve?
Thank you. If you'll recall, last week we had an opportunity to speak to the board about some of the movements that we had been engaged in with respect to enforcement. We talked about the individual mandate associated with the mask. We talked about the mandate of the employer to require that each employee have a mask. But we talked about the difficulty associated with enforcement of individual patrons that may visit a business with a mask. Late on Thursday, July 9th, the state of New York, through the Department of Health, issued emergency regulations. They're very different than executive orders. These are actually adopted by the Department of Health. They have a fairly significant impact because they empower the local governments to enforce in areas that may have been questionable under the executive orders. I will note that under 10 NYCRR 66-3.2 sub A, the individual face mask mandate has actually now been included. And I think it's important that I read it aloud for you, if you do not mind. Because there's been some discussion about that individual mandate. That individual mandate states, any person who is over age 2 and able to medically tolerate a face covering shall be required to cover their nose and mouth with a mask or face covering when in a public place and unable to maintain or when not maintaining social distance. Social distance has been defined by the Department of Health as being 6-foot separation from members that are not a part of the same familial household. So, you are capable of being in public without a mask, theoretically, if you are capable of maintaining an appropriate social distance. That social distance is identified by the Department of Health as being 6 feet. Now, if you take a look at 10 NYCRR 66-3.2 sub B, that includes the employer mandate for the employee. So that has now also been codified in regulation. Interestingly, though, is the addition of sub D. So 10 NYCRR 66-3.2 sub D. This provision now mandates that employers deny service or businesses deny service to individuals that attempt to enter their establishment without first donning a mask if they are incapable of maintaining social distance. This was something that before, if you'll recall, we talked about this provision in the executive orders, and the executive orders had made it optional. It now is no longer optional. If an individual attempts to patronize a business and that business cannot ensure the social distancing measures of that 6-foot separation between members of separate households, they are required to wear a mask. And if that mask is not donned by the patron must be denied service and denied entry into the structure. Now, if the business fails to do so, the individual business can now be liable for not enforcing the individual mandate. And what I mean by liable is that if you take a look at 66-3.2, you will see included in the provisions is a penalty section. And in that penalty section, it indicates that the individual who has failed to don the mask is subject to potentially a $1,000 fine. And the businesses themselves, under Public Health Law Section 12-B, can actually be fined up to $10,000 for that failure. For the first instance, $2,000, for the second instance, $5,000, and for each additional instance thereafter, $10,000. If the individual is regularly engaged in an act of disobedience by the rule, that individual can face a $1,000 fine for each date or each instance of disobedience. So there is now an enforcement mechanism that theoretically empowers the local government to engage in an enforcement through fine mechanism. Not to say that we have moved to that stage yet, because I will tell you that as a county, we have yet to issue any fine. However, we have issued a significant number of warning letters. There was a time when we were engaged solely in an educational component, hoping that most people would abide by the appropriate orders. And I have found, and I believe that Ruth will attest to this, as will the sheriff, that most people have. When we brought it to their attention that they have an obligation under the executive orders, they have found a way to become compliant where they otherwise were not before. But we have had a few situations where that has not been the case. And we are now empowered under the Department of Health regulations to theoretically impose a fine on businesses that fail to comply.
Questions on that right at the moment?
Foresight.
Stephen, that was regarding the mask. What about larger gatherings?
That's an interesting provision under 66-3.2 sub C. Sub C actually provides that gatherings shall be no larger than 10 people. That's contrary to the provisions associated with the executive orders. In fact, Executive Order 202.49 just expanded on the gatherings until August 6th to 50 people for any gathering size or 50% capacity in any structure. What 66-3.2 sub C states is that it is 10 people unless superseded by an executive order. So if those executive orders lapse and that regulation is not rescinded, technically we would fall back to a position in which the Department of Health guidance would say we are at no more than 10 people for gathering for any specific reason. So that is included in the new emergency regulations that were brought forward.
And there have been a number, I think Mr. Arquette.
Mr. Arquette.
Yes, and again, I'm about keeping everybody healthy and safe, following the guidance of our medical health directors. But as we're talking about inflicting a potential $1,000 fine on folks within our county, as our leadership sit in a room with many people that I can see, whether you're 6 foot or not, it doesn't really appear that from here. So we as a body are going to inflict penalties on people and businesses in our county about wearing masks and social distancing when we're very clearly violating that right now, potentially, or at least it looks as I'm watching this. And again, why I'm not in the room. So I would definitely not support and would be highly against inflicting penalties on any businesses or people that aren't wearing masks or are not social distancing, as we, the leadership, are doing just the opposite. And I must say, our county attorney, our administrator, I both witnessed you with masks on throughout the proceedings, and our chairman of this particular service committee, but I'm seeing several others that aren't. And again, I'm happy that this board we agreed that if legislators did not want to appear at this meeting because of their concerns around social distancing and masking, that we agreed not to do that. So I applaud the group for that, but I'm real hesitant on inflicting any types of penalties on either citizens or businesses about wearing masks when we're convening for no particular reason other than your choice and with no masks.
Mr. Lightfoot.
Mr. Arquette, I think if you heard right, you would have heard the county attorney say that these are authorized. Nowhere did he say that we were going to do that. Nowhere did he say that it was even being contemplated. So I think you're jumping the gun a little bit on that. And I think also with respect to the spacing, I think if you take a good look, at least most of the people here are 6 foot apart. And they chose to be here, and I certainly applaud them for wanting to be here. I applaud you for doing what you want to do. We left that up to the individual. So please don't disparage us for being here and wanting to do this in public, and we're not disparaging you for wanting to stay home and do it from there.
A follow-up, please, Mr. Chairman.
Go ahead, Mr. Arquette.
Yes, I didn't in any way say that we were inflicting them. I said I particularly, as one person of this board, would not be in favor of it while we choose, some of us choose to meet, whether we're 6 foot or not. Again, if you're watching this and you're a businessman, you may be 6 feet apart. It doesn't appear that way. And again, I do not begrudge anybody for being in the room. I'm appreciative that the board agreed that it was our choice. And if you can review what I said previous to this, I did not say that you were going to. I did not say the county attorney was going to. I simply said I would not be in support. Thank you.
Mr. Burke. You're on mute, John.
Sorry about that. Along with what Tony said, I think it's great that some of us can stay home and do the Zoom, and I appreciate the accommodations made. As Tony said, my concern, and I really, if the legislators choose not to wear masks, that's their prerogative. Steve outlined the guidance for that. But here's the thing. We heard from, again, the 5 points that Dr. Williams outlined. And we also heard from Dana last week. It's social distancing and masks. And when we expose our employees to that, Ruth, Dylan, Steve, anybody else that's there, the public that comes in, I think it takes on a different emphasis. I mean, I think it's fine if if it was just legislators who were choosing to meet, but when we bring our employees in, or when we bring the public in, I think that there is a burden upon us to follow the guidance of our own public health department. And again, I'm not, by no means am I trying to pass judgment, but on the other hand, I think we have an obligation to protect our employees. And if the legislators choose not to do it, and it's within the guidelines that the states handed down, that's fine. However, we still have a responsibility to our employees and to the public. And I think that in consideration of that, everybody should be wearing masks. Thank you.
Any other comments? Continue, Ruth.
Okay. One of those who did receive letters from the county attorney's office was Walmart, as mentioned to you last week. And over the weekend, they did respond to us by letter, which we mentioned to you, but they have also identified an individual that is identified with a black golf shirt that is thanking folks for wearing masks when they come in and counting the folks entering Walmart. So we're pleased to see.
Legislator Haggard, did you have your, okay, I'm sorry.
Did you call on me, Mr. Chair?
Yes, I did. I'm sorry if I missed you.
That's okay. Thank you. To back up what John and Tony were saying, I hope that it's not misconstrued that we want to stay home and would rather sit at home and Zoom. I would rather be there, but each of us has to make that choice based on our own health concerns too. And so for an assumption to be made that we choose not to be there because this is more convenient, I think it's inappropriate to assume that. I think it would be better if we could all be together, but given each individual person and their needs, some of us have to be more careful than others. And as was said, I think Tony pointed out, and I think you backed it up, Mr. Denisha, that we should be allowed to have this option, but we could all be together if everybody wore masks. Thank you very much.
Okay. Thank you.
Now moving on to, sorry. I apologize, I have to chime in on that. We could all be together as long as we were spaced 6 feet apart. I think to say we could all be together if we all wore masks is sort of inflammatory, frankly, and I don't appreciate it in a setting where people go to ATV riding without masks, they go to gatherings without masks, and
I guess just to say, oh, we could all be here if you would just wear a mask, I don't appreciate it at all.
Legislator Haggard.
Thank you, Ms. Curran. I don't partake in things where I don't wear a mask. And so I know you pointed out that there are people that go to things that don't wear a mask. I don't want you to assume that I do those things, but thank you for your point.
Now, is it okay with everyone if we get back to the county legislator, or the county administrator's report? Go ahead, Ruth.
Okay. Moving on to social services, to give you an update. The staff are doing an outstanding job, all county staff, but specifically social services, working this week to get back to supervised visitation with proper precautions in place. I joined the meetings of their supervisors to give them an open line of communication. And as discussed last week, Mr. Zimmerman has been over there since Wednesday, working to address their needs, bring forward concerns, and be able to continue working until we have a commissioner appointed. And to that end, I did want to give the chairman of the search committee an opportunity to announce the recommendation for appointment. If he would prefer that I do it, I'm happy to.
I think it's fine. Ruth, why don't you go ahead? You were the one that spoke with her. I think you can fill in more details.
Sure.
Thank you.
The search committee is prepared to recommend Cynthia Ackerman to the board for consideration at the August 3rd board meeting. Ms. Ackerman currently works for the ARC of Jefferson St. Lawrence and has tendered her resignation and will be joining us should the resolution be adopted August 17th. Any questions? Okay. Moving on now to what you can look forward next week at Finance. Our second quarter financial update will be provided to you. Also a resolution. I spoke with you, I believe towards the end of the first quarter about the changes in the court-ordered commitment costs that were passed in the New York State budget for 2020-2021. There's an assumption of what was a 50% share with the state to now a 100% cost to the county. So far this year, we have paid $118,848.60. We have over $148,000 in outstanding bills. That projected out through the rest of the year. In April, it was for 3 people. In May, it was for 2. Will come in the neighborhood of $500,000. So I will bring you a resolution to make that adjustment. Should they be released from care, that cost would be alleviated. But when in fact those bills continue to arise for the rest of the year, we need to make the Office of Mental Health whole based upon the change in the law. We are currently verifying the process, but notice was provided to the county attorney that the sales tax resolutions, some of you may recall, not the last extension, but the one prior to that, to be made of the state need to be done for this next 3-year extension. So pending confirmation of that, we will bring a resolution to you to authorize the request of the state to extend the 1%. I believe that it's a formality. I think it's been already accomplished, but in order that we be in keeping with the state's requirements, we'll bring that to you. And lastly, under the Finance Committee, before I go into budget, I want to recognize our treasurer, who gets to give you the better news about the county sales tax. I think you're muted.
You're muted.
Thank you, Ruth. It is, I think, a lot better news than we were expecting to see today or this quarter, even this year. But we can't take it too far, but we'll take what we can get right now, right? I emailed earlier today with the final quarterly results for the second quarter sales tax. And it last week, or I think about a week and maybe 10 days ago, I had sent you some information. I said, hold off until we have the last one. So our last payment is actually the reconciling payment for this quarter. And I guess I'll go with the second quarter with the AIM adjustment. this quarter, we were seeing a 5.95% reduction, or $891,000 and roughly, and some change. And when I refer to the AIM adjustment, I'm talking about the adjustment that started, I believe, last November or December. We received an adjustment to our town sales tax. This one is our village sales tax, and that amount was a little over $452,000. In order to true up what those numbers look like, if I reduce this year's sales tax by that amount, we're actually at 2.94% under last year's sales tax. That's really amazing, because this quarter is our COVID quarter. You know, not a lot of explanation for it, except for the fact that I think where we live is really, we are largely based upon day-to-day living. We aren't a huge boom economic area. So I think we felt a little less pain than a lot of areas in the state. Year to date, numbers look even better because we had a great first quarter. So in our year to date, if we include the AIM, we are only down 0.23%. If we exclude the $452,000 AIM reduction, we're actually 1.35% ahead of last year, where we weren't in COVID and we didn't have all of these issues in front of us. So I realize that the impact of AIM is going to carry forward for quite some time, but compared to other counties, we are actually in a much better position. I had received an email from NISAC regarding the rest of the state, and actually they're down 6%. So for us to be ahead 1.35% is very good news for us on the scale of things. In addition to that, you know, we budgeted, I don't know exactly the dollar amount, I'm just gonna throw out a number, I think like about $2 million less for this year than we actually received last year. So that's gonna help us. It will help us with this year's results, and it will help us when we go forward, because this year's budget is a starting point whenever we start to build next year's budget. So we didn't set ourselves up for a huge letdown. It's still going to be very difficult, and there's a lot of questions that are unanswered, but this is good news as far as sales tax goes. And that, I guess that I'll stop at that.
Any questions?
Great news, Renee, thank you.
Dave has a question.
David?
One thing we have to remember out of that sales tax is we have a population of 110,000. I would say probably 80 to 90% of our citizens got a $1,200 stimulus check, which I don't know too many people that have any stimulus money left. If there's 90,000 and 1,200, it's 108 million that's been spent. So we gotta keep that in the calculation in the back of our head. That was, and stimulus checks went out in the last quarter. Unless there's a change, they're not gonna be going out in this quarter, so.
No,
That's a big
and we're
part.
still not in receipt of any tribal state compact funds, and we are still lagging. Typically, our occupancy tax is our strongest quarter in the third. We are, last we checked, 20% behind there. So there's a lot to be considered.
But it's definitely good news, definitely.
Any other questions for Renee before we let her sign off? Thank you, Renee.
Thank you.
And the last few items around budget for the projections for 2020 and the entry and request for 2021. The entry is currently underway in departments, and we structure the departments into two groups. We traditionally look at the smaller departments, county cost, and we have the larger departments like social services, community services, things like that. So we separate out the due dates for their budget entry. The first is on the 24th, and the second is on the 31st. So for the majority of this month, departments will be furiously entering both projections, which we have emphasized the importance this year over any other, with looking carefully at spending as well as what revenues are looking like. You heard Jay Ulrich tonight from Community Services talk about what those expectations are starting to look like. And other departments as well will start seeing some reductions in the revenue coming from the state. For those who are new among us, I just wanted to mention the schedule. We will take a look at department budgets as a budget team, internal staff review, from August 4th through August 28th. In September, the budget team will review and prepare the budget to be presented by me on Monday, October 5th. That will be presented at the end of the board meeting. Now, some of you that have been around a while, just wanted to go over the options that we can talk more about at finance. The last 4 years, we have done the budget process by way of jurisdictional committee. So for example, tonight, operations and services would have had the opportunity to ask questions of the departments who report to each of those committees, and likewise at finance. However, if we look back a bit further, prior to 2016, we used to schedule each and every department to come before you, review their budgets, talk over their issues, and often make requests of you during that process. So both of those are options and certainly available to you. What I wanted to do was to give you an opportunity to think about that and that we could discuss it further at finance. Each year, I put together a standard schedule that we could follow if you choose to do department reviews. Those would typically be Monday, Tuesday, and sometimes Wednesday of the month of October and November. Or we can continue with the jurisdictional committee review and have departments available. I would imagine it's unlikely that we'll return to the committee structure we had physically, but certainly I think it's been working well to have them present via Zoom as an option. And lastly, that's it for budget. Are there any questions on that process? I will share out the schedule with you on Google Drive under budget and welcome you to join any of our budget meetings. Certainly some departments take more time than others, but you're certainly welcome to sit with the budget team by Zoom or in person if you'd like. I would mention also that besides the St. Lawrence County Fair being canceled this year, next meeting at finance, we would be meeting in Governor. We'll have to hope for that next year, as there won't be an event this year. My last update to you tonight is that finally the modifications to accomplish social distancing and notices for entrance and exit in county facilities here in Canton are complete. In Messina and Ogdensburg, they were finished today, and tomorrow in Governor and Star Lake, they should be wrapped up. That will allow us to begin moving more towards an in-present office staff again. I'm hopeful at finance to share with you what the staffing levels are and what the plan is to return and how far we are from that, as well as talk about the options or the board's entertainment to the idea of a telework policy. Certainly we would want to have input from both departments, bring you data as far as what the experiences were and the challenges. Not everyone had a great experience working remotely. We'd like to share that back with you and be able to, in the coming months, come up with a solution that makes sense for everyone. Questions?
Doesn't look like it, Ruth.
All right, that's all I got.
Committee reports. Start with myself, Ag and Farmland Protection Board. Nothing to report since our last report. Next one is Alternatives to Incarceration Board, Mr. Burke.
Nothing new to report. There hasn't been any meetings.
Thank you. Board of Trustees, we don't have we appointed anyone? This time, no. Emergency Medical Services Advisory Board, Legislator Curran.
Hi there. We passed the new bylaws, but we have not had an additional meeting since then.
Thank you. Environmental Management Council, Legislator Creminelli.
Okay, thank you, Mr. Chairman. So our last meeting was on June 17th, and we started with a presentation by Planning Director Jason Fotenhauer. He spoke with the group that was on about the large-scale renewable energy proposals that are coming through the planning office right now. Just some background information about what defines large-scale projects and the legislation that oversees those projects. We talked about the Northside Energy and the Rich Road solar proposals, and there were some comments and discussion about how to best involve county planning so that solar projects promote environmental and wildlife preservation, as well as integrating farmland. The Conservation of Resources Subcommittee is actually going to take on the task of looking into the effects of large-scale solar on the agricultural environment. We talked a little bit about the Madrid's fish ladder and the pros and cons of a fish ladder versus a bypass, and we're hoping to invite somebody in to speak to the group that has some expertise in the area of fish ladders and bypasses. And then I wanted to share Emily Sheridan from the DEC. The DEC is presenting webinars. They're every Tuesday at 2 o'clock. So July 14th, the 28th, and August 11th. It's the New York Great Lakes Action Agenda webinar series. So they're webinars that speak to natural resources, sustainability and resiliency, and then education and research. And this year is the 50th anniversary since the Board of Supervisors established the Environmental Management Committee. So they're hoping to do something in honor of their 50-year anniversary. Our next meeting will be Wednesday, the 15th, this coming Wednesday at 6 o'clock via Zoom.
Thank you. Fire Advisory Board, our next meeting is Thursday, August 20th. And at our last meeting, which was in June, it was announced that we were going to be able to restart some training on a limited basis at the training center, which was good news. And the other thing we talked about was the implementation of a burn ban based on input from emergency services coordinator, the fire chiefs, fire coordinators around the council of the county. Inter-county legislative committee, legislative current.
Hi there. My first meeting will be this month and it will be conducted by Zoom. And when I have something to bring back, I will update you.
Okay, thank you.
Thank you, sir.
Jury board, legislative Sheridan.
Chairman, the jury board is not met.
Thank you. And planning board, legislative Fay.
Jason, our director of the planning office, covered 4 items that were talked about at last Wednesday's meeting. It was held by Zoom. A couple of items I'd like to talk about. The things that we have to do with the planning board is updating the town code in the town of Louisville. To give you an example, we talked about restaurants, we talked about taverns or bars. We don't talk about microbreweries or farm breweries, or so all of these new terms that are coming up that we have to help the villages or towns update their codes with. The town of Brazier, we looked at on County Road 3, we're breaking up 40.1 acres into 7 residential building lots of some type. So that was reviewed. A lot of it was built on soil testing that will have to be done in the area. And the other thing they really talked about is a little bit was Messina, Brazier, and Norfolk solar projects, ones that seem to be moving forward.
Good.
Thank you.
Thank you. Does anyone have any old business to come before committee? Does anyone have any new business to come before this committee? Ms. County Administrator, do we have a need for executive session?
We do, for all 4 categories.
We do have a need for executive session for all 4 categories. Mr. Forsythe and Mr. Fay, Rakers. All those in favor?
Aye.
We are into executive session.
If you give us just a few moments, we will pause the YouTube live stream. Thank you.